when she did the pregnancy test is negative. In this live session, answering this question that has been asked by one of our friends. The next question is that she actually gets miscarriages at 7 weeks. She gets pregnant very easily, but when the pregnancy is at 7 weeks, she actually experiences a miscarriage. She's asking herself what could be the main reason for a miscarriage happening at 7 weeks. The next question is going to be about periods. Can a woman see her periods in 3 days? Can a woman see her periods in 3 days? The next question is going to be, why does she experience a metallic taste in early pregnancy? The next question is going to be, why does she experience a metallic taste in early pregnancy? And then, of course, we shall talk about the dry skin around the neck. She actually gets a dry skin around her neck. She's asking herself, why is it that she keeps getting dry skin around her neck? Next question is going to be about periods when a woman is infertile. Can a woman who is having difficulties getting pregnant, can she get her periods? So we shall go straight away to the first question. I welcome you, my friend, who is on this live session today. If you do have questions about fertility, you can ask your questions. I will be able to reply to all your fertility questions. I'm called Gerald Massa and I'm a fertility coach. I can answer all your fertility questions. So the first question is about back pain, but the pregnancy test is negative. She is experiencing back pain, but the pregnancy test is showing that she is negative. I mean, she is not pregnant. Why is it so? Why is it that she's not pregnant, but she is actually experiencing back pain? So when a woman has done the pregnancy test, maybe she has done the pregnancy test today, and the pregnancy test is showing a negative result, and yet she is experiencing back pain. The first point we need to take note of is, did she see her periods? Because a woman can easily think that she is pregnant, and yet she actually saw her periods. When a woman sees her periods, normally it actually means that she didn't get pregnant. So the first sign to really confirm that maybe a woman has got pregnant is she actually has to miss her periods. When a woman misses her periods, then it's very advisable that she does the pregnancy test. Now, why would a woman who actually has missed her periods, why would a woman who has actually missed her periods and she thinks that maybe she's pregnant, why would she be experiencing back pain? The back pain could actually be due to the changes that are taking place in her womb. The back pain could also be due to pre-existing conditions, like maybe she could be having masses in her uterus, she could be having swellings. The back pain could be a sign of infections like maybe PIDs, we call these pelvic inflammatory diseases. So if you are pregnant, if you are not pregnant, the pregnancy test is showing that you are not pregnant, but you are experiencing back pain, the best advice is that you could actually go to your doctor, and then your doctor will do proper tests on you to really confirm why you are experiencing back pain and yet you are not pregnant. The next question is about a miscarriage after 7 weeks. Yeah, she gets pregnant very easily, but at 7 weeks, she experiences a miscarriage. She gets pregnant very easily, but at 7 weeks, she experiences a miscarriage. Why is it that she gets pregnant very easily, but as soon as the pregnancy makes 7 weeks, she actually gets a miscarriage? This is the question. So, in early pregnancy, 7 weeks specifically means that a woman is pregnant and the pregnancy is at 4 months and basically 3 weeks. So when a woman is pregnant and then after like 1 month or 1.5 months the pregnancy comes out, it could be an issue with either the male sperms, it could be an issue with the husband's sperms, maybe the quality of the husband's sperms could actually not be good, and then it could also be due to issues on the side of the woman. Early miscarriages when a woman experiences early miscarriages, when a woman experiences pregnancy losses at around 7 weeks, it could actually mean that maybe the quality of the egg that was fertilized was actually not really so good. So when an egg has poor quality, remember to know that a woman has good quality eggs or poor quality eggs. She has to do tests. These have to be done by her doctor in a hospital near her. The test that can actually show the quality of a woman's eggs is actually known as the anti-Mullerian hormonal test, AMH test. The other tests that can actually show the quality of a woman's eggs include the FSH test plus the LH test. Why do I talk about FSH and LH? FSH is a hormone and LH is a hormone. FSH and LH are actually hormones which are actually known as gonadotropins. They originate from the brain, and when they do come in, they bring about egg growth, they bring about egg maturity. So if you do your FSH and the levels are actually very low, because we know that the normal is supposed to be 2.5 up to around 10. If you do the FSH hormonal test and the levels are actually very low, it could actually mean that there's something that is actually not right. If you do the FSH test and the levels are maybe higher than 10, maybe they are in 20s, 30s, it could actually mean that there's something that is not right. Why would a woman experience repeat miscarriages? We call this repeat pregnancy losses at 7 weeks. Number one, it could actually be due to the poor quality of the woman's eggs. It could be due to the poor quality of the husband's sperms. It could also be due to issues like maybe stress. It could also be due to other conditions like maybe the lady got pregnant, but she actually also had other conditions like malaria. She got pregnant, but she's actually hypertensive. She has high blood pressure. Early pregnancy losses at 7 weeks could actually be due to several of the points I've just talked about. Remember, you can ask all your questions in the comments below. I'm called Gerald Massa. I'm a fertility coach. I can answer all your questions regarding fertility. So feel free to ask all your questions. Let me take this opportunity to welcome our friends, and we have Queen Mariam. Queen Mariam, you are most welcome to today's live session. And your question, okay, you're 43 and you have been trying to conceive for long, but now 2 years and you're not seeing your periods. Okay, yeah, Queen Mariam, I'm going to answer your question. Queen Mariam, nkwaniriza ku live session yaffe ya leero, ngenda kuddamu ekibuuzo kyo, so I'm going to answer your question. Please stay on the live, and then you are going to get all the answers to your questions. So I've finished the first part of the question, which was talking about back pain and yet the pregnancy test is negative. The next question is about pregnancy. Can a woman see pregnancy in 3 days? Yes, so the next question is about pregnancy tests. Can a woman see her pregnancy when she does a pregnancy test? Can she see a pregnancy test in what? In 3 days. So when a woman has missed her periods and then maybe she does the pregnancy test within the first week or within the 3rd week, there is a high chance that she could actually see, there could actually be a high chance that the pregnancy test will show results. Remember, in early pregnancy, it's always recommended that you do what we call a serial beta HCG pregnancy test, or you could actually just do a serum pregnancy test whereby your doctor will get a sample of your blood and then they will do the pregnancy test using a blood sample instead of using the urine HCG pregnancy tests. Urine HCG pregnancy testing is actually also good, but it's recommended to do this at around 8 weeks or even at around 9 weeks, because sometimes they could actually take long to detect the HCG hormone. They could take long to detect the pregnancy. Okay, let's go to our first question that came in from, okay, we have the first question that came in from Mariam. Let me go through this question. Talk about blighted ovum. Okay, Mariam, I'm going to be answering your question, but let me begin with a question that came in from Becky, and she was saying that I talk about a blighted ovum. Becky, thanks a lot for asking this question about a blighted ovum. Well, blighted ovum, also known as an embryonic pregnancy, is a situation when a woman actually gets pregnant. The egg that has been fertilized travels through the fallopian tubes, it reaches the woman's womb, it reaches the inside of the woman's womb, but the fertilized egg that attached itself onto the wall of the uterus fails to actually have an embryo. A blighted ovum, yes, a blighted ovum simply means that a woman is pregnant, but she's pregnant with an empty gestational sac. A woman is pregnant, but the pregnancy or the baby's sac is empty, there's no embryo. Blighted ovums are actually due to many causes. Blighted ovums could actually be due to changes in a woman's chromosomes. When I talk about chromosomes specifically, these are the real material that actually make up what we call the DNA of a woman's egg. So if the chromosomes are having issues, if the man's sperm is having issues, then there's going to be a risk of a woman getting what we call a blighted ovum. So blighted ovum simply means that a woman is pregnant, but the baby's sac is actually very, very empty. This can actually be detected when you go to a hospital for a routine ultrasound scan. When you do the pelvic ultrasound scan at the hospital, in most cases, your doctor could actually see a very big baby sac, but inside the baby sac, it is actually filled up with fluid. We call this amnion, we call this amniotic fluid. That fluid is what was supposed to support the baby if the baby had gone inside the baby sac. So a blighted ovum can be confirmed via an ultrasound scan. You have to do an ultrasound scan. This can be a transvaginal ultrasound scan. Yes, thanks for the likes. Thanks for tapping on the screen. I'm really, really humbled. Yes, so a blighted ovum can be confirmed when a woman does an ultrasound scan. And remember, the ultrasound scan should actually be done at around 8 weeks or even around 9 weeks. Some hospitals in some countries, they actually confirm blighted ovums at around 10 weeks, okay? But the recommended time of confirming whether a woman is having a blighted ovum, you actually have to do the ultrasound scan at around 7 weeks, 8 weeks, 9 weeks, or even 10 weeks. When it has been confirmed that a woman has a blighted ovum, in most cases, your doctor will give you the next plan of management. This can be discussed with your doctor, but in most cases, they could actually opt to remove the pregnancy, because when the pregnancy is at around 10 weeks, but there's no embryo, the pregnancy is 10 weeks, no live embryo, there's no baby inside the sac. Rarely, these pregnancies do not proceed. So I hope you've got something about a blighted ovum. Becky, you asked about a blighted ovum, and I hope I've answered your question about a blighted ovum. Remember, you can also ask your questions down below in the comments, and then I'll be able to answer your questions. You can also tap on the screen so that you can actually, the live session can actually reach more people. So keep tapping on the screen, keep sharing. Okay, we have a next question coming in from a friend, and she was asking, Bridget, how are you doing today? Yes, Bridget, you are most welcome to today's live session. Remember, I'm live on YouTube. YouTube is here, and then I'm live on TikTok. So if you are on YouTube, I'm really, really happy that you have joined me. I'm always live on YouTube from 3 p.m. up to around 6 p.m. Ugandan time. Live on TikTok from 3 p.m. up to around 6 p.m. Ugandan time. Mbera koku TikTok, neku YouTube, live at the same time. So you don't need to worry if you are on YouTube, you can still access this live session. Okay, so let's proceed. I hope there are more questions coming in. Stella, you've asked a question and you are saying that, can people with endometriosis conceive? Can people with endometriosis stage 3 conceive? The question is coming in from one of our friends, and she is asking that, can a woman who has endometriosis, and this endometriosis is at stage 3, will this woman be able to get pregnant? We shall first of all begin by talking about endometriosis before we talk about the pregnancy part of it, okay? So endometriosis simply means that the tissue that is actually supposed to make up the inside of the woman's uterus, the tissue that is supposed to make up what we call the endometrium. The inside of a woman's womb is made up of tissue, okay, which is actually known as endometrial tissue. When this tissue, which is known as endometrial tissue, when it actually grows from outside the woman's womb, when endometrial tissue grows in the fallopian tubes, when endometrial tissue grows in the intestines, we call this endometriosis. Endometriosis simply means that the tissue that makes up the inside of the woman's womb is growing outside the woman's womb. Remember, it is the same tissue that actually undergoes what we call bleeding. It's the same tissue that undergoes what we call periods. When a woman sees her periods, it is the endometrial tissue that is actually shedding. What I'm trying to talk about is this. When a woman has endometrial tissue, this tissue which is inside the womb is also growing in the fallopian tubes. When she experiences her periods, it means that the bleeding will also happen in the fallopian tubes. It means that the bleeding will also happen in the intestines. So it is a very painful condition. Endometriosis is a very painful condition. The question was, when a woman has this condition, when a woman has endometriosis, specifically stage 3, this is actually really advanced, will she be able to get pregnant? The answer is, if she has, or if she receives proper management by her doctor, when she receives proper treatment, okay, chances are there that she could actually get pregnant. But remember, the chances are very, very low. But with proper management, she can actually get pregnant, okay, because there are newer methods of actually bringing about pregnancy, which are also known as assisted reproductive technologies, ART. These actually include methods like IVF, in vitro fertilization. They do include methods like IUI, in intrauterine insemination. But the main point we need to take from endometriosis is that tissue that is supposed to receive the baby, that tissue that is supposed to receive the fertilized egg, is growing outside the uterus, okay? Meaning that proper stabilization has to be done. That's why I was saying that it's actually very important for you to sit down with your doctor, and then your doctor will be able to guide you on the next steps you need to follow. So we shall first of all talk about the endometrial tissue. Let's first go deeper in the endometrial tissue, because the question was, will a woman with endometriosis get pregnant? The endometrial tissue is made up of several layers. The endometrial tissue is made up of several layers. There are actually 3 layers of tissue that make up the endometrium. We have the outer layer known as the stratum compactum. We have the innermost layer known as the stratum spongiosum, and then of course we have the stratum basalis. Now, if the endometriosis has eaten maybe the first 2 layers of your inside of the womb, the chances of pregnancy will actually be very reduced. Endometriosis has to be stabilized first of all, of course, via a proper management or a proper plan of action. We call this hormone replacement therapy, plus other treatments which could actually be surgical. This can be done in a hospital near you, but to summarize everything, a woman who has endometriosis has to visit her doctor, who will do a proper assessment on her, including ultrasound scans to really confirm how far this endometriosis has eaten. And then of course other managements include the fertility hormonal tests. These specifically include FSH, LH, we have progesterone and estrogen. The most important hormones in endometriosis include estrogen, progesterone. Estrogen is also known as estradiol. So the most important hormones include estradiol and then of course progesterone hormone. This can actually be confirmed by your doctor. Let's move to the next question. Okay, yes, Mariam, you said that, okay, the lady is 43 years and she has been trying to conceive for a long time, but now 2 years and she's not seeing her periods. I remember answering this question in the live session which was there the other day. Yes, so she's 43 years She has been trying to conceive for a long time, but now it is 2 years and she's not seeing her periods. Mukwano gwaffe abadde agezaako okubanga afuna olubuto for 2 years naye nga tali kulaba periods. She has been trying to conceive, but she's not seeing her periods. She's 43 years and then 2 years no periods. So we are looking at a scenario whereby a lady is actually 43 years old. She has actually spent 2 years without seeing her periods. She's asking herself, will she be able to get pregnant? First of all, what we have to actually understand is that for pregnancy to happen in women, in most cases, the eggs have to actually be growing. The eggs have to grow. They have to undergo the 3 stages or the 3 phases of growth, whereby when she has just finished her periods today, the eggs are going to grow from the first stage, known as the primary stage. The eggs will move to the secondary stage, and then of course there's going to be a dominant egg that is going to come out. Now this dominant egg, we call this the dominant follicle. It is actually what is fertilized during the time of ovulation. So the question was, she's 43 years old and she's actually not seeing her periods for 2 years. Will she be able to get pregnant? Remember, I've just said that for pregnancy to happen, at least a woman has to be seeing her periods. Seeing your periods simply means that the eggs are growing. Seeing your periods simply means that ovulation is taking place. It's going to take place maybe around the mid of your cycle. So if you are not seeing your periods, normally it will be very, very important for you to confirm with your doctor to really confirm as to why you are not seeing your periods, okay? First of all, when a woman is not seeing her periods for at least 3 months, or even 6 months, or even 1 year, this could actually mean that there's something that is not right. It could actually mean that there's something that is not right either in the woman's brain, okay? I will expand more on this. It could be actually an issue that she's not seeing her periods. We call this amenorrhea. She could not be seeing her periods when the issue is actually, she could actually not be seeing her periods when the issue is with the ovaries, okay? The ovarian tissue, amajige, the eggs, okay? She could actually not be seeing her periods when it is an age-related issue. Remember, she has said that she's actually around 43 years. So if a woman is not seeing her periods and the problem is in the brain, specifically there's a small part in the brain known as the pituitary gland. If the pituitary gland is not releasing the hormones that are supposed to bring about the growth of the eggs, if the pituitary gland is not releasing sufficient levels of FSH and LH hormone, then it means that the eggs are not going to grow. If the eggs are not going to grow, or if the eggs are not growing due to insufficient levels of FSH and LH hormone, then it means that there's not going to be ovulation. If the woman is not ovulating, then it means periods are not going to appear. So to really confirm as to why you are not seeing your periods for 2 years, it could actually mean that maybe there's an issue with your eggs. Maybe they're not growing well. Maybe the hormones are not balancing. Maybe the quality of the eggs has gone low. How can you confirm all this? When you go to a hospital near you, remember my live sessions are for educational purposes only. My videos are for educational purposes only. Watch them, learn something, and then dig deeper with your doctor. Kwagala Patience on YouTube, you are most welcome on today's live session. I'm really, really happy that you have joined today's live session. I'm so happy. Kwagala Patience. Talk about the ovulation tests. It's okay, I'm going to talk about the ovulation tests, Kwagala, on YouTube. I'm going to talk about this. But let me complete with this question. She has spent 2 years without seeing her periods. So I was saying that when a woman is not seeing her periods, we call this amenorrhea, okay? So if a woman is not seeing her periods, it could be an issue with her eggs. It could be an issue with a small part in the brain known as the pituitary gland. When she goes to her doctor, in most cases, her doctor will do proper tests to really confirm why she's not seeing her periods. These tests could include an ultrasound scan, specifically a transvaginal ultrasound scan. Your doctor could also decide to do what we call a pelvic ultrasound scan. Now you could ask yourself, now Gerald, fertility coach, why are you talking about ultrasound scans and yet she has missed her periods for 2 years? When the doctor does the ultrasound scan in a woman who has missed her periods for 2 years, the ultrasound scan doctor, sonographer, is going to pay close attention to the inside of the womb. The doctor will actually pay close attention to the endometrium. If the endometrium is enlarged, very big, okay, the scan doctor says that your endometrium is actually in 30 millimeters, it is in 40 millimeters, it is in 50 millimeters. 50 is so high, okay. 50 could actually be among the first signs of maybe a woman who is at risk of maybe developing what we call endometrial cancer of the inside of the womb. But we are talking about pregnancy. So if the ultrasound scan doctor shows that or says that the inside of the womb is so enlarged, then we shall go backwards and ask ourselves, what normally brings about the inside of the womb to swell? Okay, then we shall go backwards and talk about estradiol hormone, okay, estrogen hormone. Then we shall also look at progesterone hormone. If estrogen and progesterone hormone are not balancing, if estrogen, the ratio of your estrogen hormone is not in line with the ratio or with your progesterone hormone, they are not balancing. Maybe progesterone is so high, okay? Maybe estrogen is so low, maybe estrogen is so high. It could actually be among the reasons as to why a woman could actually experience what we call chronic amenorrhea. No periods for 2 years. Okay, the other reason as to why she could actually not be seeing her periods could actually be in the brain. There's a small part in the brain known as the pituitary gland. So if that part is actually not functioning very well, it's not releasing sufficient levels of FSH and LH hormone, it could actually also cause issues. So my advice is kindly confirm with your doctor. Your doctor will do the proper tests, and then this could actually include the radiological tests, including the ultrasound scans, and then of course also the hormonal tests will be done. Once the cause has been identified, I believe by the grace of God you can be supported. Remember, there are newer methods like the assisted reproductive technologies. Okay, the question by Kwagala Patience on YouTube, Kwagala Patience, you said that I talk about ovulation tests. Now, ovulation tests specifically are tests that are actually made, or these are tests that actually detect the levels of the ovulation hormone, the levels of LH hormone. Remember, LH hormone, also known as luteinizing hormone, it is a hormone that is actually released from the brain. Okay, specifically, it is one of the hormones coming in from your pituitary gland, small part in the brain. It is the hormone that actually comes after FSH has been released. So scientists went ahead and then manufactured these hormones, these strips that can actually detect the LH hormone. The ovulation test, okay, the ovulation predictor tests are actually very available in pharmacies near you. And if you are asking yourself, when do you use these ovulation predictor tests? When do you use these ovulation tests? Normally, it is advisable that you begin detecting or you begin doing these ovulation tests around the 9th day, 10th day, 11th day, up to the 14th day if you have a 28-day menstrual cycle length, okay? So the ovulation predictor tests or the ovulation tests are special tests that detect the levels of your LH hormone. They detect what we call the amounts of your luteinizing hormone. If you do the ovulation predictor tests, or if you do the tests for ovulation and the ovulation tests show that they are negative, and yet according to your tracking, maybe you've used one of the apps that are available on Google, your tracking, your calendar shows that you are supposed to be ovulating, but the ovulation predictor tests show that you are not pregnant, then the ovulation predictor tests show that they are negative. Then it could actually be among the first signs or the first reasons or the first indicators of a woman who is having difficulties ovulating. But remember, you don't need to do what we call self-medication. You need to go back to your doctor who will guide you on the next steps to follow. Because if the ovulation predictor tests show that they are negative and yet you are in your ovulation time, we need to go back to where LH hormone comes from, what you're testing during ovulation. We need to go backwards and look at that part known as the pituitary gland, okay? We need to look at it. Are there some growths, some swells that are affecting your pituitary gland? Okay, this can be confirmed by an MRI scan, which will be done by your doctor, magnetic resonance imaging scan. This can be done by your doctor to really confirm whether there are growths around your pituitary gland. The other reason as to why your ovulation predictor tests could show negative and yet you are ovulating could actually be an issue with your eggs themselves. Okay, it could be an issue with your eggs in such a way that maybe the ovarian tissue, your ovaries, are not carrying sufficient amount of eggs, and maybe the eggs are not growing, and maybe they are not responding to the effects of LH hormone. So I believe, Kwagala, you've learned something about ovulation tests. And if you do have more questions about your fertility, you can always message me on WhatsApp. And remember, my consultation fee is only 11k Uganda shillings, and you can always let me know when you are ready, and then we shall actually dig deeper in your questions. I'll be able to give you all the answers. Remember, you can get my WhatsApp numbers on my bio. On YouTube, the numbers are on my profile. On TikTok, the numbers are also on my bio, so you can always get them. After the live session, you can put your questions. Remember, consultation fee is only 11k Uganda shillings, okay? That's around $3. If you are on YouTube and maybe you are outside Uganda, you are in Kenya, you are in Nigeria, you are in the UK, and you want to consult me, it's only $3, $3 US, okay? Yes, so very, very affordable. So next question is coming in from, Okay, as I'm waiting for more questions to come in, let me go back and talk about dry skin around the neck. One of our friends asked that she experiences a dry skin around her neck. She's asking herself, why is it that she has a dry skin around her neck? Dryness of the skin. The first reason as to why a woman or a man could be experiencing dry skin or a rough skin or an itchy skin, it could actually be more of an allergic reaction, okay? If you have not been putting on maybe a particular type of lotion, if you have not been using a particular type of lotion, if you have not been using a particular type of necklace, and then maybe you get a necklace, you begin putting on that necklace which is made up of maybe some certain type of metal, like maybe copper, or if you have maybe put on a cloth which is actually so sensitive to your skin, it could be among the reasons as to why you could experience skin changes. But remember, reactions of the skin could actually be due to allergy. So you need to visit your doctor for skin, dermatologist, who will actually advise on the proper steps you need to follow, the proper medications, proper creams, topical creams which can be applied. So dry skin, in most cases, it could be allergic. It could be the type of soap you're using. It could be the type of lotion you are using. Next question was about periods when a woman is infertile. Can a woman who is having difficulties getting pregnant experience periods? A woman who is having what we call subfertility. There's no infertile woman. Normally, a woman tends to have what we call subfertility, failure to get pregnant due to a cause, okay? So when a woman is having difficulties getting pregnant, okay, will she be able to see her periods? When a woman has difficulties getting pregnant, will she experience, or will she, when a woman is infertile, will she be able to see her periods? Okay, when a woman has difficulties getting pregnant, will she be able to see her periods? The answer is yes. A woman could actually have difficulties getting pregnant, but she will be able to see her periods. Though in some women, they could actually also have difficulties seeing their periods, but the biggest percentage of women see their periods normally, but at the same time, they actually fail to get pregnant. Now, you could ask yourself and say, Gerald Massa, the fertility coach, why are you saying that a woman who is having difficulties getting pregnant is at the same time, seeing her periods, okay? A woman could actually have difficulties getting pregnant and see her periods normally when the issue is actually on the man's side, okay? Yes, she could actually go ahead and see her periods very well. They do all the tests and everything is normal, but when actually the issue is with the husband, so she actually needs to sit down with her husband, and then proper tests need to be done, and then these tests can really confirm. If a man has issues like azoospermia, I was actually going to talk about azoospermia, but I can dig deeper in this issue right now. So if a man has a condition known as azoospermia, azoospermia simply means that a man releases fluid. We call this seminal fluid. This fluid is made up of elements like zinc. It's made up of things like magnesium. These are nutrients which you can easily get when you do eat maybe pumpkin seeds. When you do eat lots of avocados, you can actually get these nutrients which can actually help if at all a man has issues. But the issue is this: if the man has what we call azoospermia. Azoospermia simply means that the man releases fluids. There's no live sperm. There's no sperms that can actually fertilize an egg. So if a man has azoospermia or oligospermia, oligospermia, or asphenozoospermia, or any other condition affecting his sperm production and then his sperm transport, if a man has any of those things, the woman will actually go ahead and see her periods normally. The woman will go ahead and ovulate normally. She does the ovulation. Yes, please, you can actually send a message on WhatsApp. I'll be able to reply on YouTube. You've asked about, please send a message on WhatsApp. I'll be able to reply. So what I was trying to say is that a woman will be able to do the ovulation predictor tests, and they will show that everything is normal. She's ovulating very well. A woman will go ahead and do the HSG, hysterosalpingogram, and the HSG X-ray will show that the tubes are very clean, okay? They might even go ahead and do the tubal cleaning, okay? To really confirm the tubes are okay. Maybe there was some little blockage, some little fluid, hydrosalpinx. They will do the tubal cleaning, and actually the repeat HSG X-ray will show that everything is okay. A woman will go ahead and do the fertility hormones. She will do FSH, it is normal, around 5 or 6, okay? That is immediately after her periods. A woman will go ahead and check for LH, luteinizing hormone. Luteinizing hormone is very normal. She will check for estrogen. Estrogen is normal. She will check for progesterone. She will go ahead and look at AMH, okay, anti-Mullerian hormone. It's also very normal. It is 2.5. It's very normal. But she's not getting pregnant. The issue could actually be an issue with the husband. The husband could actually be having issues like maybe azoospermia, okay? Empty sperms, empty fluid. There's no sperms that can actually bring about fertilization. A man could actually be having oligospermia. Quantity is very low. A man could actually be having complications like asphenozoospermia. So once these have been identified, proper treatment can be done by your doctor. And remember, if a man has what you call total azoospermia, normally it could be an issue with transport of the sperms, okay? Maybe along the tubes, because very well that sperms are produced from the man's testes, okay? In Luganda, we call this ensigo. So sperms are produced from the man's testes, okay? Normally, most men have 2 testes, the balls, okay? But there are some men who are born with one test, okay? When there are 2, they are testes. When it is 1, it is a test. There are men who were born when they had issues with the testes, or the testes going down in the sac, going down in the scrotal sac. The scrotal sac is that shell where the test is supposed to be embedded, where the test is supposed to grow from. So if a man was born with such a condition, okay, whereby the tests at birth were actually hidden in the abdominal wall. Specifically, there's a tube in the abdominal wall known as the inguinal canal. If the testes remained in the abdominal cavity, in the abdomen, and then at birth, the mother does not check the baby's balls. It's advisable at birth, or maybe a few weeks after giving birth to a baby boy, you try gently, okay? Gently, you try to squeeze, not overdo it, okay? Don't overdo it, it could be painful, but you gently squeeze the baby's sacs, the baby's balls, and see. At the tests there, you need to feel some little tender, soft, okay, balls. You need to be very gentle when you're doing this, or you could go to a hospital and then your doctor will do the test, or the checkup, the examination. If at all at birth the testis, the scrotum, okay, was empty, there are no testes, and then maybe the mother does not know that maybe this is not a good thing, and then she keeps quiet, okay, maybe lack of proper awareness, maybe she's not watched maybe videos like these ones, and then maybe she just keeps quiet, and then the baby grows into a teenager. The baby grows into a man, he matures, and remember this is a sensitive condition whereby the young man could actually decide to actually keep quiet with the condition. He goes into maturity, studies, goes up to campus, he marries, or he gets a stable job, he marries, he settles down, but he has grown up with the condition, which was actually not managed at birth, okay? This condition is known as cryptorchidism. Cryptorchidism, failure of the testes to descend, failure of the testes to move from the abdominal cavity into the sac. If a man has this condition, definitely there's going to be difficulties making his wife pregnant. This can be confirmed on a routine ultrasound scan. We call this a scrotal ultrasound scan. The scrotal ultrasound scan is a scan for the man's balls. It's a scan for the man's testes and sigo. The scrotal ultrasound scan can actually go ahead and then show the man's testes, how they are appearing. Is there fluid inside? Are they visible? Okay. The scrotal ultrasound scan can also go ahead and actually give pictures of a particular part known as the epididymis. The epididymis is basically that part where sperms, after being manufactured in the testes, they actually go in the epididymis and then they rest a bit. Why do they rest a bit in the epididymis? They rest in the epididymis that they can actually mature very well, await the right time when this particular man is with his wife, and then maybe during the process of intercourse, the matured sperms will be released, which will travel through that small tube known as the spermatic tube, or known as the vas deferens, go through a particular part known as the bulbourethral duct, go through the seminal vesicles, go through the prostate gland, and then inside the woman, that is during intercourse. The main reason why sperms have to travel through your bulbourethral duct, your seminal vesicle, your prostate gland is basically to receive nutrients like the zinc I was talking about, nutrients like the fructose, nutrients to support these sperms on the journey they are going to travel through the woman's womb, through the fallopian tubes, and then lastly to the mature egg known as the dominant follicle, which would actually be waiting in the fallopian tube in a part known as the ampullary part of the fallopian tube. Okay, so you could actually be having, I'm summarizing, you could be having normal periods, and you are asking yourself why you're not getting pregnant. You are thinking that you're the one with the problem, when the problem is with the man. Maybe he has a condition known as cryptorchidism, failure of the testes to go down in the sacs. The man could actually be having a condition known as azoospermia. Azoospermia. Okay, azo means nothing. There are no live sperms in that sperm, basically in the fluid that is coming out. Okay, so I think that's enough about azoospermia, oligospermia, asphenozoospermia, cryptorchidism. I think that's enough about that. Remember, you can always come on WhatsApp for a one-on-one session at only $3 if you are outside Uganda. If you are in Uganda, it's only 11k Uganda shillings. Very affordable, and you'll get answers to all your questions. I'll be able to answer your questions personally. Okay, so you can actually find my numbers on my bio, on my profile. I'm called Gerald Massa, and I'm a fertility coach. I'm certified by the American Society for Reproductive Medicine, meaning I'm certified to actually advise you, to coach you on your fertility. If you have been trying to get pregnant and things are not working out, okay, you could actually be having an issue which needs actually proper explanation, which needs to be elaborated for you in a way you can actually understand easily. I can do that by the grace of God. So the next question was about azoospermia. I've talked about azoospermia. Okay, let me check if there are questions coming in. Okay, YouTube, Kwagala Patience, thanks for sticking around. I'm very humbled, and everyone who is on YouTube, I'm so humbled that you are on YouTube, you are on TikTok. Thanks for sparing some little time for us to really talk about your fertility. You'll excuse me, there's a client. Let me talk to this client a few minutes. Okay, so on YouTube, Kwagala Patience, yes, thanks, my God bless you, I'm coming there very soon, if I don't conceive this year. Okay, yes, Kwagala Patience, I'm really, really very humbled, and remember, whenever you are ready, I will also be ready. You can always find my numbers on YouTube for proper direction. You can check my profile on YouTube, Massa Gerald, the fertility coach. So let's go ahead and talk about other questions. Remember, you can keep bringing in your questions. Please ask your questions, ask your fertility questions. You've done the ultrasound scans and you are not really understanding your ultrasound scans. You've done the fertility hormonal tests and you are not understanding them. You can always message me. I'll be able to simplify them for you. I'll be able to explain them for you in a language you can easily understand. Got period on 4th. When can I conceive a baby girl? Okay. When can I conceive a baby girl? So the question is about when a woman is most likely able to conceive a baby girl or a baby boy. Okay. Now, one thing we have to understand is that sex determination is actually by the man. Okay. It's not by the woman. Although there are studies, there was a study that was done by a doctor known as Dr. Shetos in the US, and he put forward a theory whereby he said that when you have intercourse on the day of your ovulation, okay, now this was a study, but remember, being that it was a study, it's actually not a conclusive proof that you are going to be getting pregnant when you follow it. Okay, it might work for you, it might not work for you. So Dr. Shetos put forward a theory after doing a study on several couples, and he said that when a couple has intercourse on that specific day of ovulation, okay, when they have intercourse on that specific day of ovulation, there's a chance that they could actually conceive a baby boy. But remember, this was a study by Dr. Shetos in the USA. And then he also put forward a theory that when a couple be together at least 3 to 4 days before the ovulation day, then the chances are there for a baby girl. Why? The main reason was that the sperms that actually carry that gene for the boys actually travel very fast and then they die very fast. So probably that was a study that was put forward by Dr. Shetos. You can try to follow it, but I'm not giving you conclusive proof that it's going to work out for you, okay? Yes, so he put forward that a baby boy, you be with your partner on that specific day of ovulation. Baby girl, you be with your partner 3 to 4 days, okay, to the day of ovulation. So if you are going to ovulate in 3 days or 4 days from today, you actually be with your partner like today, and then maybe you hold on a bit. When the ovulation reaches, maybe there are chances. You never know. There are couples who have given testimonies that it works, so you can try it. But the most important thing is you need to put in prayers. Everything we have to put in prayers, okay? Yes, because God is the creator. So one thing about sex determination, whether a woman is going to get a baby boy or she's going to get a baby girl, normally one thing you have to understand is that part that is supposed to determine the sex of the boy, we call this the sex determining region. That small part is actually on the man's sperm. It's not on the woman's egg. So sex determination is by your husband. If you do not get a baby boy or you do not get a baby girl, do not put the stress on yourself. And for the men, if your woman gives birth to boys alone or girls alone, okay, you do not need to stress your wife that maybe she's the one with the problem. No, sex determination is by the man. On the sperm, we have the head, we have the neck of the sperm, we have actually the tail of the sperm. So there's a part known as the sex determining region on the sperm. That part is actually what determines the sex of the child the mother is going to give birth to. So for the men, if you are on this live session and you are a man, do not stress your wife that she's giving birth to boys alone or she's giving birth to girls alone. I hope that's enough about baby boy and baby girl. Yes, but remember there are newer techniques, there are newer methods. We call these the assisted reproductive technologies. These methods can actually be used, and then of course you could maybe end up with boys alone or girls alone through what we call IVF, in vitro fertilization. Okay, keep bringing in the questions, keep asking the questions. I'll be able to answer. If there are no questions, I'll go back through the questions. The first question was about why does she experience back pain, but the pregnancy test is negative. Why does she experience back pain, but when she does the pregnancy test is negative? Why is it that she experiences back pain, but when she does the pregnancy test, the pregnancy test is negative? And I was saying that she could be doing the pregnancy tests, and the pregnancy tests are showing negative, and yet she's experiencing back pain, but the back pain could be due to something else. The back pain could be due to maybe issues in the fallopian tubes. The back pain could actually be due to endometrial issues. Maybe there's an issue inside the womb. This could actually include maybe fibroids, the chizimba. There could be a fibroid, a swelling inside the womb. It is the swelling that is causing the back pain. You could be experiencing back pain, you're missing your periods, but you are not pregnant, and yet the back pain is actually due to maybe what we call occupational causes. This could actually be due to the fact that maybe you sit a lot, maybe you've put on lots of weight. Okay, yes. So you need to actually confirm with your doctor, who will do a proper assessment on you to really confirm as to why you are experiencing the back pain, and yet the pregnancy test is negative. The only way to confirm that you are pregnant is, number one, you first have to miss your periods, okay? Normally, that current of blood a woman sees, okay? She could actually call it a period, but when it is what we call spotting or implantation bleeding. But when a woman misses her periods, and then in the first to the second to the third week, she begins experiencing changes or pregnancy signs like maybe breast pain, issues like maybe changes in her test, we call this a metallic test, or even loss of appetite, or even the breasts enlarging or increasing in size. This could actually be among the first signs that you could actually be pregnant. What do you need to do to confirm that you could be pregnant? You begin by doing what we call the urine HCG pregnancy test. You can easily get these pregnancy test strips from a clinic or a pharmacy near you. These can actually be given by the staff, and they will guide you on how to do the pregnancy test at home. You could actually do also the pregnancy test at the clinic, okay? And then once the results show that there are two faint lines, whether one is dark and then the other one is faint, or whether both of them are dark, it could actually be a sign, or it could actually be a confirmation that you are actually pregnant. But remember, you can easily get a positive pregnancy test and yet you are not pregnant. It could actually be an issue that may be inside the womb. There's a swelling, we call this a tumor, that is actually producing, or that is releasing the HCG hormone. Because the strips, the pregnancy test strips, they look for the HCG hormone. So it could actually be that you are testing for pregnancy, the test strips are showing that you are pregnant, but you are actually not pregnant. It could be an issue with maybe a swelling inside your womb. There are other swellings that can actually bring about changes in the pregnancy test, and these swellings specifically include what we call the gestational trophoblastic disease. We call this a molar pregnancy. These swellings appear, or they behave, or they bring about changes which could actually be kind of like a pregnancy, but in real sense, when it is not a pregnancy, we call this a molar pregnancy. We call this a gestational trophoblastic disease, GTD. This has to be confirmed when you go to a hospital near you. Your doctor will do what we call a pelvic ultrasound scan or a transvaginal ultrasound scan. Now, these scans, the scan doctor will show most likely that there's a big mass inside the womb, okay? And that mass has fluid-filled sacs. We call these vesicles, okay? And specifically, there will be no heartbeat. So sometimes when you take a look at that ultrasound scan, you'll see as if something pumping, but normally there's no heartbeat, and then there's no normal gross anatomy, there's no normal gross appearance of maybe an early pregnancy or an early baby that is growing, okay? There will be no fetal head, there will be no definite cardiac activity, there will be no limbs, okay, the hands and the legs. It will just be a swelling. Okay, the scan doctor will most likely say that the uterus is big, okay? The uterus is big, it's filled up with a swelling, and this swelling specifically has fluid-filled areas. We call these vesicles, okay? And normally the management, your doctor will actually handle the other part of the management. Normally it is actually removed because normally gestational trophoblastic diseases, much as they give a pregnancy test which is positive, normally they do not progress to a viable pregnancy or a healthy pregnancy. Okay, I think that is it. And then let me go through the questions. Please, friends, if you do have questions about fertility, put your questions in the comments. I'll be able to answer. Both on YouTube, we have Kwagala Patience on YouTube, Kutumideko. My greetings to you, Kwagala Patience, and all our friends on YouTube. And then also on TikTok, sending my greetings to all our friends. We have Bukenya Douglas, we have Queen Mariam. You are most welcome to today's live session. I'm really, really humbled that you've spared some time to join me on this chat, fertility chat. Yes, so, okay. On YouTube, please keep the questions coming. Let me go on TikTok and see if we do have new questions. Remember to ask all your questions about fertility. If you are okay with the Luganda version, you can ask your questions in Luganda. I will reply. Yes, but to reach a broader audience, I'm looking at English, but you can still use Luganda. Yes, so the next question, there are no questions. Okay. Okay. D, you were asking about HSG. Do you do HSG? D, I'm actually a fertility coach. I don't do HSG X-rays. You could actually find a hospital near you, and then of course, in the radiology department of the hospital, they will guide you through the HSG. You can also message me on WhatsApp. I can recommend to you the best places to do an HSG, depending on where you are. Okay, if you are in Uganda, you can always on WhatsApp. I can actually give you a recommendation that you go to this place. They actually have the best HSG X-rays. Okay, so you can message me on WhatsApp. Okay, Flavia Sisi Atim. Flavia Sisi Atim, you are most welcome to today's live session. I hope you're still on, but because I've just seen your question right now, and I think I need to improve the speed. I need to be speedy because the questions are now coming in, and they are actually, yeah, keep the questions coming in. I'm going to try. It's now 4:40 p.m. Yeah, we still have time. So, Flavia Sisi Atim, you've asked that. Yeah, okay. Okay, but I want to get pregnant. Okay, then. So the question is coming in from a friend, and she's asking that if a woman has PCOS, if a woman has polycystic ovarian syndrome, and she sees her periods every month, okay, monthly, her periods are normal. I want to get pregnant, what should I? Okay, then, can a woman get pregnant? Okay, then, so the question is about a woman with PCOS, okay, polycystic ovarian syndrome. She sees her periods normally. What are the steps she needs to follow to get pregnant easily? What are the steps she needs to follow to actually be able to actually achieve the fruit of the womb? First of all, we shall dig deeper into PCOS. I always like to go deeper. I always like to go to the root cause before we talk about the part of the treatment, because the treatment part is the easy part. But identifying the root cause, identifying what really brought about the issue, and then it actually makes everything much more simpler. So we shall go deeper and talk about PCOS. PCOS, also known as polycystic ovarian syndrome. PCOS is also known as polycystic ovarian disease. It is basically a hormonal condition. It is a hormonal condition. It is a condition which is actually brought about by hormonal changes. We call these hormonal imbalances. Inside the system, inside the body of a girl, when she's born in this world, she's born with her own hormones. Okay? Yes, a girl is born with her own hormones. Now, these hormones are very many. These hormones include FSH, LH hormone, estrogen hormone, progesterone hormone, testosterone hormone from the adrenal glands, and of course from the ovarian tissue. A girl is born with specific hormones which are actually supposed to bring about the girlness or the female, those features which will make her to be a woman. Now, at one point, when this particular girl grows up into a responsible lady, then she gets a stable job, and then maybe the lifestyle changes, and then maybe the diet changes. Maybe at school she used to eat a particular type of diet, but the lifestyle changes due to maybe the availability of maybe different things to eat. Okay, the diet changes from that diet which actually is recommended, the diet of maybe eating something organic from the garden, and then maybe she does more of like fried things, and then things which contain lots of sugars, and then all that. Normally, sugars, we call these artificial sugars, or even the sugar we use at home, belongs to what we call the hormonal disruptors. Sugar tends to disrupt a woman's hormones. I'm not saying that you should stay away from sugar completely, but if you can, then it's better for you. More so if you have been confirmed to be having what we call PCOS, polycystic ovarian syndrome, because high sugars and PCOS, they don't move hand in hand. High sugars and complex high glycemic foods, they don't move hand in hand. Okay? But we shall reach that part. Let me try to be fast because the questions are many. A woman has PCOS, but she's seeing her periods every month. What can she do to get pregnant much more faster? Of course, the first step is you need to actually confirm with your doctor that you really have the PCOS. Okay? I believe, or I suppose you were told that you have PCOS because you did the tests. These tests include the transvaginal ultrasound scan. Then they also include the hormonal tests. Okay, whereby your doctor will look at several hormones, most specifically the hormones for egg quality, and then most specifically the hormones for the male hormones. We call these the androgens. Okay, if your testosterone hormonal levels are high, if your AMH is also elevated, very high, AMH is 10, testosterone is also very high, maybe it is 8, maybe it is 10. Okay. And then maybe other hormones are also not balancing. It could actually be one of the signs. It's not a confirmation, but it could actually be one of the things that could be indicating that you could be developing or you could be having PCOS. How can you know that you have PCOS? Normally, there's going to be those male features. I say that women with PCOS tend to have high amounts of the male hormones. We call these androgens. So the question was, what can she do to get pregnant? It's actually a question whereby we are supposed to jump straight to the management, but I was first of all digging deep about PCOS. I hope by now you know something about PCOS. Now, a woman who has PCOS to get pregnant, number one, she actually has to follow her doctor's advice, her doctor's medications, or the prescriptions which were given or which were recommended by her doctor. What I'm going to talk about is basically to complement on what your doctor has given you. I'm not stopping you from following your doctor's advice. I'm not replacing your doctor's prescription, okay? But I'm complementing, I'm adding on what you were prescribed for, okay? If you are taking your metformin, if you are taking your gonadotropins, or if you are taking already medications, like maybe the coenzyme Q10 and then the rest which you were prescribed by your doctor, I'm not saying that you stop taking that. You can continue taking your the medications which were recommended to you by your doctor. But the other things you could actually add on, if you do have PCOS, you could look at maybe your body mass index, your weight, okay? If it is actually high, normal body mass index is supposed to be 18.5 up to 24.5. So if your body mass index is actually very high, maybe it is in the 30s, okay? You are overweight, you should actually look at losing your weight, okay? You could come on WhatsApp and then I will teach you more about weight loss. Next, if your diet has been made up of foods which are actually high in sugars, you should opt or you should look at reducing foods that are high in sugars. Because managing PCOS is not about taking medications alone. Managing PCOS is not about taking metformin every day, okay? It's not about taking tablets alone. It's about looking at yourself in a holistic way. Looking at yourself whereby you should actually do the medical part, but also look at reducing weight. And then remember, if you are exercising, you are not supposed to over-exercise, because if you do exercises and then you go beyond the recommended 30 minutes, your body will actually begin releasing a hormone known as cortisol, stress hormone. And then remember, cortisol can still go ahead and interfere with your other fertility hormones. So you can actually message me on WhatsApp and then we shall dig deeper about this. But remember, with PCOS, once you work on your diet, once you actually lose weight, once you manage stress, once you have enough sleep, that is 7 to 8 hours, okay, per night, and then I'm talking about real deep sleep. If you do those things, there are high chances, by the grace of God, there are high chances that you could actually achieve the fruit of the womb. So you can come on WhatsApp, then we shall dig deeper on PCOS. If you still want a one-on-one session, remember my consultation fee, my coaching fee on WhatsApp is only $3. That's around 11k Uganda shillings. If you are outside Uganda, you can actually reach me on WhatsApp. The numbers are on my profile. At only $3, we can have a one-on-one coaching whereby I'll give you answers to your questions, and normally the answers are within 10 minutes. Okay? Yes. So next question. Okay, then the next question is coming in from a friend. I will not be mentioning names, but she's talking about pine. Okay, she talked about something to do with piles, okay? These swellings that actually tend to grow around the part where she does poo from, okay? Yeah, those swellings that tend to actually get filled up with kind of like swelling. When they are filled up with blood, normally these are blood vessels around the anus, but if they do get filled up with blood, we call this engorged, okay? They get filled up with blood and then they swell. Normally they are so painful. We call these hemorrhoids. And then if they are actually swellings but they are not so big, sometimes we could actually call these piles. And then if they are just tears around maybe your anus, and then they're just small tears, we call these anal fissures, okay? But she was specific, she said piles. I hope you said piles. So the management of hemorrhoids, specifically, it depends on the stage of the piles. It depends on the stage of the hemorrhoids. And for how long have you been having them? If they have just come and then within 2 to 3 days you are experiencing them, you could look at adjusting your lifestyle. You could look at adjusting your diet. If you have been eating foods that are actually kind of like hard, okay, starchy foods, chapatis, and then the rest of the things, without eating a bogoya, without drinking lots of water, without avoiding sitting for long hours, then it could actually predispose you to what we call the hemorrhoids, okay? These are blood vessels which tend to get filled up with blood. Now, if a person has had hemorrhoids for a very long time, 1 year, 2 years with hemorrhoids, they actually have swollen and they tend to bleed and they are actually becoming very dangerous. It's actually advisable to visit a hospital near you whereby you'll be able to talk to your doctor. Specifically, it could be a general surgeon, okay? They are very good in doing hemorrhoid repair. We call these hemorrhoidectomies. These are treatments that can be given to you by your doctor in the hospital. So if you have swellings in your anus, if you have hemorrhoids, and then they've been there for like 1 day, 2 days, 3 days, look at adjusting your lifestyle, okay? Do not sit for long hours. Tend to actually increase the fluid intake, okay? Nywa amazi mangi. Then you should also adjust your diet. Try to reduce on the starchy foods, try to reduce on the hard foods like the chapatis, and then do more of bogoya, do more of menvu, sweet potatoes, sweet bananas, yes, do more of sweet bananas, and then drink lots of water. And then you could also look at doing some specific aerobic exercises. They could actually also help. But if the hemorrhoids have been there for a long time, 1 year, 2 years, please, you need to visit a hospital near you. Then your doctor will be able to guide you on the management of the hemorrhoids. Normally they are removed through a procedure known as a hemorrhoidectomy. But this has to be done in a specialist hospital, in a referral hospital. Do not go to a clinic and then you say you want the doctor to remove the hemorrhoids, it has to be done in a big hospital. So go to a hospital near you, then they will manage the hemorrhoids. Okay, the next question is coming in from, I love these questions about getting pregnant fast. She's saying that she wants tablets to help her get pregnant very fast. Okay, it's a question that is actually asked by very many couples, specifically very many women, because they are looking at getting pregnant very fast. Maybe an introduction is coming in, maybe there's pressure from the family side. Okay, yes. So one thing I'm going to advise you, my friend, who is actually asking for tablets for getting pregnant, please, please, please do not self-medicate. Okay, it's my role as your fertility coach, it's my role as a fertility educator to tell you that please do not self-medicate. Do not watch a video about a drug and then you run to the pharmacy, buy the medicine, and then you take the medicine. It could actually cause complications. The commonest medications that is actually talked about is actually what we call Clomid. Many times women mistake Clomid. Women take Clomid wrongly. Please do not self-medicate. It's advisable that you confirm your diagnosis, or you go to your doctor who will confirm actually the main issue that is actually preventing you from getting pregnant. And then once confirmation has been done, treatment will be given. So the question was, what are the tablets for getting pregnant much more faster? Number one, first of all, confirm the reason as to why you are not getting pregnant. This has to be done by your doctor through proper testing, including a pelvic ultrasound scan, including a transvaginal ultrasound scan. Also, your doctor could opt to look at maybe your hormones to really see, are your hormones balancing? If everything ticks out, your hormones are okay, your AMH is normal, your FSH is normal, everything is normal, your HSG, X-ray is normal, then your doctor would maybe say that, you know what, talk to your husband so that he can also come for a checkup. Okay, so once the cause has been identified, treatment becomes much more easier. Please do not self-medicate. Why? Because fertility medications are sensitive and they could actually bring about effects which are not good. The commonest effects of fertility medications is actually what we call ovarian hyperstimulation syndrome. Okay, there could be other side effects like the nausea, and then of course a bloating stomach, and then those can actually go. Okay, as soon as you're done with the fertility medication, those ones can go. But ovarian hyperstimulation syndrome, OHHS, is very stubborn. Why? Because this is actually when your ovaries, the follicles, the eggs which were supposed to grow, you overboosted them, okay? You took lots of, maybe the fertility medication, maybe you took them wrongly, you didn't go to your doctor. The follicles get filled up with fluid, okay? And when they get filled up with fluid, they enlarge. They actually make movement very difficult. They actually cause lots of pain. When you are maybe sleeping, maybe when you are with your partner, you are sitting, you are eating lunch, but the pain is too much. You go for the ultrasound scan, the scan doctor tells you that, you know what, I'm seeing very big fluid-filled masses. We call these cysts, which are kind of like together, and then they are on your ovarian tissue. Maybe they are on one side, okay, or they are on both sides. And if at all confirmation has been done, of course your doctor will advise you on the medications. In this particular case, you don't continue with the fertility medications. Why? The more you take the fertility medication, the more you take the Clomid, the more it's going to make the swellings to be much more enlarged. The danger is that when they rupture, then it would actually be something which is not good. So please, as I'm summarizing this question on the medications for fertility, please do not self-medicate. Okay, I'm looking in the camera and I'm telling you, my friend, do not self-medicate. Avoid self-medication. Much as you want to get pregnant, much as you are on pressure, your partner is telling you, get pregnant or I'm getting another woman, please do not bend into pressure. Follow the right protocols, okay? Talk to your partner. Tell your husband that, you know what, getting pregnant is not a one person's side, okay? It's not a woman who makes herself pregnant. No, it is the man who makes the woman pregnant. The guy could be stubborn, he doesn't want to go to hospital, but maybe when the guy has azoospermia, The guy could refuse to go to the hospital when the guy has oligospermia. The guy could be having asthenospermia. The guy could be having undescended tests, but he has kept quiet and he has not told you, okay? Yes, of course, remember, when a man has undescended tests, he can perform very well in bed, and the main challenge is pregnancy. So it's actually advisable that you go together. Talk to your partner, talk to your husband, go together to hospital. They will do the tests on the man, they will do the tests on the woman, and then, of course, once they discover, the doctors discover where the deficiency is, where the problem has been, that can be corrected, and then by the grace of God, pregnancy can happen. I think that's enough about tablets for pregnancy. I've not received my period back. It's now 6 months after giving birth. Okay then, so when a woman gives birth, the question is, she actually has not received her periods and she gave birth 6 months back, okay? 6 months ago, she gave birth, but up to now, she has not seen her periods. She's asking herself, why is this? Okay then, so when a woman gives birth and then she's breastfeeding, she has not told us whether she's breastfeeding, okay? Yes. So main wife, please try to tell us more about, are you breastfeeding or you're not breastfeeding? Why? Because if a woman gives birth today and then she begins breastfeeding exclusively simply means that every time the baby cries, okay, the breast is in the breast, the baby will be breastfeeding. Exclusive breastfeeding means that a woman breastfeeds all the time. So if you gave birth 6 months back and then you are breastfeeding daily, consistently, during the day you're breastfeeding, at night you're breastfeeding consistently, then you could actually forget about your periods. You're not seeing your periods because you are breastfeeding daily. What is the science behind? When a woman breastfeeds daily, the brain, specifically a small part in the brain known as the anterior pituitary gland, is going to be very happy. It's going to send a hormone known as prolactin. Okay? Prolactin? Yes. Prolactin hormone is the result of another hormone coming in from another part in the brain known as the hypothalamus. So there's a hormone, first of all, known as prolactin releasing hormone, which will come in from a small part in the brain known as the hypothalamus. Prolactin releasing hormone will go to the anterior pituitary gland, and then it will tell this part that, you know what, I'm seeing she's breastfeeding exclusively, please send prolactin. And when prolactin comes in, it is a hormone that is responsible for breast milk production. So when prolactin hormone rises during breast milk production, and then of course during breastfeeding, prolactin is going to stop the release of other hormones which are supposed to bring about the eggs growing. So a woman who is breastfeeding, the eggs will not grow. So you are not seeing your periods because these things, all these changes are happening in your brain. I hope you've got the answer to this question. You gave birth 6 months back. You are not seeing your periods because you are breastfeeding exclusively. You are breastfeeding daily. It's a normal thing. You don't need to stress yourself. The day you stop breastfeeding, that is the day the brain will begin to sense that, you know what, she's no longer breastfeeding. So prolactin go back or go downwards. Prolactin lower. Normal is supposed to be 0 up to 25. Okay? So when you are not breastfeeding, your prolactin hormone is going to lower. And then when prolactin lowers like this, the brain will actually send the hormones for egg growth. These include FSH and LH. When FSH and LH rises due to the prolactin lowering, then it means a woman is going to ovulate. Then it means she's going to get pregnant. Those are the women you realize that, those are the mothers you realize that she's breastfeeding, but at the same time she has got pregnant. Why? Because she was not breastfeeding consistently. Okay? Okay. That's enough about breastfeeding. I hope you've got your answer. Please, when I've answered your question and you're satisfied with the answer, please, you can always message back. I mean, appreciating that, you know what, I've got the answer. Otherwise, I might maybe think that maybe you didn't get the answer. So you send the feedback that you've got the answer. So I've answered this question about she gave birth 6 months back, but the breast milk is not, she's not seeing her periods, and I've said that it's a normal thing. It's a normal occurrence, so you don't need to stress yourself, okay? Hormones are taking charge. Prolactin is high because you're breastfeeding. Okay, friends, keep tapping on the screen to really confirm that you're still on the live session. Yes, I might be talking when I'm talking to myself. So keep tapping on the screen to really confirm that you are still in class. Keep tapping on the screen. On YouTube, I don't know how they do it, but I think on YouTube, you can actually like the live session. You can actually also tap on the screen. I believe on YouTube, you can also tap on the screen. And then you can share this live session amongst your friends. By the grace of God, we are here live from 3 p.m. Ugandan time up to around 5 p.m. or 6 p.m. It's already 5. Okay, let me try to be very fast. What causes painful periods with clothes? Keep tapping on the screen. Keep tapping on the screen. Please, 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 please. Keep tapping on the screen. Keep tapping on the screen. Keep tapping on the screen on TikTok, on YouTube. Please keep tapping on the screen. Yes. Okay, so what causes painful periods with clothes, Musau? What causes painful? Okay, then. So next question is about painful periods with clothes. Remember, first of all, when a woman is in her periods, okay, the inside of the womb is actually what is being shed. The inside of the womb, we call this the endometrial lining, is actually what is being shed. Remember that inside of your womb, that tissue, that tissue, when it is being eroded, when it is being shed during your periods, there's going to be release of some chemicals. We call these pain chemicals. Now, these pain chemicals specifically, they are called prostaglandins. They actually saturate around your waist, they saturate around your pelvic region, and then they cause that pain you are experiencing when you are in your periods. That pain can actually go up to your back. We call this radiating to your back. That pain can actually go up to your legs. You are in your period, but you cannot move. Why? Because of lots of these pain chemicals. We call these prostaglandins. When you go to the clinic or when you go to the hospital, most likely your doctor or staff or registered nurse or enrolled nurse or any staff who is actually certified will be able to manage this by maybe giving you a pain medication. We call this an NSAID medication, which could actually be either in tablet form, okay, this include ibuprofen and other medications, or it could actually include an injection, like the commonest, which is actually known as diclofenac. Now, in most cases, what these non-steroidal anti-inflammatory medications, painkillers, do when a woman is in her periods and she gets them, they actually go ahead. Remember, they are called non-steroidal anti-inflammatory medications, anti-inflammatory drugs. They actually go ahead and then they block the pain chemicals, the pain chemicals which were causing the pain. And once they are blocked, the pain goes away. The Musawa will ask you, are you feeling better? You'll say, yes, I'm feeling better. The pain has gone. You are in your periods, but the pain has gone. Why? Because the pain chemicals, the prostaglandins, have been blocked by the pain injection, okay? Diclofenac. Yes, but remember, I'm not advising you that you go and buy diclofenac and inject yourself. No, you need to actually go to a hospital near you, and then your doctor will assess you, because you could be in your periods, the pain is too much, and yet there's something else that is hidden that is causing the pain. Like maybe there's like a fibroid, there's a fibroid, a chizimba, that is already inside your womb, and you think that it is normal periods when it is the fibroid which is bleeding. So most likely your doctor will do a proper assessment, including proper radiological tests, and then of course this can confirm. You might be thinking that it's periods when it is an endometrial polyp which is bleeding. We call this a hemorrhaging endometrial polyp. It could be a cyst which is hemorrhaging, a cyst, a swelling which is filled up with fluid, which is actually bleeding. And for you think it is periods. So your doctor will be able to actually do a proper assessment on you, and then of course confirm really what is causing that lots of pain you are experiencing during your periods. Okay, then next question is coming in from a friend, and Moha, you are most welcome to today's live session, and you are asking about low sperm morphology. What causes low sperm morphology? First of all, we know very well that sperms, basically, these are what actually fertilize an egg, and then of course, this is what brings about fertilization to actually take place. A sperm has a head, it has a neck, it has a neck which is actually having another small part known as the mitochondrial part. This is where the sperm gets the energy to swim the whole length through the private parts, through the endometrium inside of the womb, through the fallopian tube. And then, of course, the sperm, normal sperm, has what we call a tail. Now, the question is, what brings low sperm morphology? We shall look at the word morphology. Morphology is the appearance, my morphology, okay? Morphology, it means how the sperm is appearing. We say that the normal sperm has to have a head. Sorry about that, I was stretching a bit, painful legs because of oversitting, but it's okay, let's continue with the session. So, normal sperm has to have a head. The normal sperm has to have a head, and then of course the head of the sperm has a small part known as the acrosome. Okay, the acrosome contains a chemical which is actually supposed to attach the sperm. When the sperm attaches itself on the mature egg in the fallopian tube, in the ampullary part of your fallopian tube, what enables the sperm to create a hole inside a woman's egg is actually what is known as the acrosome. A normal sperm has to have a neck. We call this the neck of the sperm. The normal sperm has to have a tail, which is actually going to enable the sperm to swim the whole length. Now, when a sperm has an abnormal appearance, when the sperm has an abnormal morphology, poor morphology, or a distorted morphology, then it means that something happened. Something happened during sperm production, when they were being manufactured through a process known as spermatogenesis. When these sperms are growing, they undergo stages whereby they could actually be called kind of like spermatogonia. They undergo all those stages, okay? So during the growth of these sperms, you could be told that you have sperms of poor morphology, and you ask yourself, what caused the issue, okay? But the main issue could actually be that when the sperms were growing, something affected their growth. Maybe the man was a rapid smoker. Rapid, I don't know whether it's the right word, but maybe if a man smokes, like he does a packet every day, okay? Cigarette smoking. If a man is working in a factory and is exposed to chemicals, we call these pesticides or chemicals, which could actually be inhaled, and then these chemicals go and mix with his bloodstream. And then as these sperms are growing, they are getting a blood supply which is full of chemicals coming from cigarette smoking, chemicals coming from those fumes which were inhaled, okay? In most cases, those chemicals could actually affect the normal growth of the sperm. So one of the causes of sperms of poor morphology could actually be exposure to chemicals, which could actually be coming from cigarette smoking. They could actually be coming from the job the man is doing. Maybe he's exposed to, maybe he be in a place where there's lots of smoke, okay? These chemicals can bring about this. And then, of course, the other part we need to talk about is when a sperm is growing, it has to be supplied with the proper nutrients. Now, these nutrients come from a man's diet, what a man is eating. As a man, okay, I'm now going to speak as myself. As a man, we are programmed to wake up in the morning, okay, prepare very fast, head out, and then begin hunting, okay? From the times when we were still, when we were still in those days of the bush days, okay? Yes, nowadays things have softened. The hunting is basically you go to town and then look for money. But the issue is men are programmed to wake up, go and look for money. Wake up, go and look for money. Provide for the family, make sure that the children are at school, make sure that fees is there, make sure we are always looking at how to support the family. But in most cases, me inclusive, we tend to forget to feed ourselves. Okay? We tend to forget that at least we also need to eat well so that we are able to provide for our families. Okay? So when a man's diet is not so good, okay, it takes long to eat an avocado, it takes long to eat an egg. Or ideally, a man is supposed to do 3 to 4 eggs according to research, but at least an egg in a day. It takes long to maybe get water, okay? Drink water, okay? Like, a man cannot, like, maybe, I'm not advertising for this company, but a man takes long to, like, drink water, okay? When he goes to bed, he's supposed to have real deep sleep, but when he's in bed, he's thinking about that loan he has not cleared, okay? He's thinking about that loan he has not cleared. He's thinking about very soon the children are coming off for holidays. How am I going to get the fees, okay? Now I'm talking from personal experience. I'm not saying that I'm talking about your man and then all that. The more we get stressed as men, the more we think a lot, the more we don't get enough rest. Normally, this tends to go backwards and then it tends to affect the growth of our sperms, okay? Sperm production tends to be affected. So the question was, what causes or what brings sperm morphology, low sperm morphology or poor sperm morphology? Summarizing, it could be diet, okay? The diet, if a man is not eating well, okay? Eating well means no avocados, is not taking or is not eating the pumpkin seeds, okay? And then is not eating like the things which bring about proper sperm growth. If the diet is not good, normally a man could end up with a report, sperm analysis test report, which is actually showing poor sperm morphology. How can you correct this? You go backwards and you correct what I've just talked about. Drink enough water, have enough sleep, eat the avocado, eat the pumpkin seeds. Fantastic, I love pumpkin seeds. And then once you do correct those things, don't be surprised for your sperm morphology to actually improve, even your sperm counts. So you need to look at those things. And then if you are on a job, you are a man, and then you are on a job whereby there are lots of fumes, you could look at getting what we call protective wear, masks. These are sold in basically many places. I think most of the big hardwares, if a man is doing a job which is more of like manual, he can get those protective gears, a mask which can protect the fumes from entering into his system, okay? Then there's also what we call xenoestrogens. Xenoestrogens, they tend to come from plastics. All of us are victims of this. Sometimes we take hot water in a plastic cup, but ideally, according to studies, it's not good to take hot water in a plastic cup. This applies to men and women. Why? Because plastic contains what we call xenoestrogens. These tend to disrupt the normal estrogen you have as a man, the normal estrogen you have as a woman, because men also, we do have estrogen. Very, very important in such a way that it is among the things which can be converted into what we call sperms, okay? So you need to look at correcting those things. Sperm morphology can be corrected, but I've not talked about infections. I was talking about the functional part of it, okay? The diet and then enough sleep and then all that. But you should also look at maybe infections. When you have been told that you have sperms of poor morphology, most likely your doctor could also go ahead and then maybe look at a urine analysis test. If the services are available, your doctor could also look at what we call a urine culture and sensitivity test. Now, normally when this shows that there are changes in some specific cells in your system known as leukocytes, okay? If they report, basically even the sperm analysis report can actually talk about the white blood cells. If your report shows that there's pus in your sperms, if the report shows that there's the leukocytes are elevated, okay, there's red blood cells in your report or in your sperms, then that can be corrected, okay? It could actually mean that the poor sperm morphology is due to the pre-existing infections, okay? Some infection a man got some time back. Okay, remember I said men were programmed to go out and hunt. So you forget about that simple infection. It goes through the opening of the penis, okay? It goes through the urethra, it eats the urethra. You go and you do susu, you're feeling burning pain, you don't go to hospital. Yeah, and then the infection goes ahead and then it reaches the prostate gland. It bangs the prostate gland, okay? Every time you feel like you want to do susu, you go and you do susu as a man. As soon as you step out like this, susu comes back again, okay? If you don't still go to hospital, the infection moves along and then it goes up to another part known as the seminal vesicle. Still, when you get stubborn, it goes ahead and then it attacks another part known as the bulbourethral duct. If you get stubborn, you don't go to hospital, then it will move downwards through what we call the vas deferens. Still, if they get stubborn and is like, I'm not going to hospital, okay? The money I'm making is for fees. The infection will go downwards to another part known as the epididymis, where the sperms are stored. Remember I said that the epididymis is that part where the sperms are stored temporarily, where they will grow and then they will mature, okay? Just like you're to take a soda, you're in Uganda and you're to take a soda, the soda has to first come from Namamve and then it will go to the depot. Now, the shop, the wholesale people will go and then they'll pick the soda from the depot and then they bring to the shop. So the sperms first rest in the epididymis. If you don't get treatment, the infection moves from the epididymis and then lastly it attacks your testes. And then of course, remember the testes have special cells where sperms are produced. These cells are two. There's a specific type of cell known as the Leydig cells. And then there's another type of cell known as the Sertoli cells. So if the infection moves from the opening of your penis as a man, and then it goes downwards, and then it reaches the Sertoli and the Leydig cells, and it eats them, or it causes fluid to accumulate in the Sertoli cells, or in the Leydig cells, then sperm production is going to be affected. And of course, when you do the sperm analysis test, don't be surprised to end up with a report which is talking about sperms of poor morphology, sperms that are not able to move very well. We call this progressive motility and then the non-progressive motility. Non-progressive motility on a sperm analysis report simply means that the percentage of sperms that are actually not able to actually move. Normally, this is kind of big. It goes backwards to what you used to eat. And then, of course, the rest of the issues. Remember, you are a man and you are on this live session. You can book a one-on-one fertility coaching session with me. If you are outside Uganda, you are watching from Nigeria, you are watching from the UK, you are watching from the US. We have friends in the US. You normally are on this live session. Yes, you can always remember that now my coaching fee, my consultation fee is only $3. That's around 11K Uganda shillings. You can always message me on WhatsApp, and then I'll be able to dig deeper, interpret for you your fertility hormones, and then of course simplify for you fertility issues. Yes, so next question is coming in from Musawo Nalwala nga 15 2020 munga 19 nashuka na kuchi mfunira olubuto. Okay then, yeah, mbadde ndikusaba fune number ku WhatsApp because byetagamo ku calculating, mbadde nsaba fune number ku gundi ku profile yange mukwano gwange Mrs. Peter, fune number ku WhatsApp jangu teka ebuzo ku WhatsApp guba mutwalo gumu ne siringi 10 okunebuzaako ku WhatsApp, fune number otekeyo ebibuzo byo nja kuweereza butya osobola okubanga bookinga, and then tujja kuba tusobola okubanga ate nkubalira ennaku kye bayise ovulation tracking. Why? Because ebibuzo bingi nnyo mukwano, ebibuzo bigenda mu nsanvu ate nga buli muntu yeetaga answers. The questions are very many. If you have questions about ovulation tracking, you want to understand your menstrual cycle very well, you want to know whether it is a short cycle or it's a long cycle, you want to know those peak days of getting pregnant, you want to know why you're not getting pregnant and yet all the fertility tests are very normal, please book a session with me. It's only free US dollars. That's around 11K Uganda shillings, consultation fee, coaching fee, and then I'll be able to give you enough, okay, to of course answer all your questions. So jangu ku WhatsApp tujja kuba twogera, is there any medicine for my wife to conceive fast? Still we go back to medications for conceiving. Remember, my live sessions are for educational purposes only. Yes, so if you are asking yourself what are the best medicines for a woman to get pregnant, to identify the best medicine or to specify or to get the best medicines for a woman to get pregnant, remember, every woman's condition, every woman's journey, fertility journey is different. I don't know the story about your woman. I don't know whether she has tubal issues, fallopian tube issues. I don't know whether she has endometrial issues, or I don't know whether she has issues with her eggs. Maybe it is a stress issue. When I go ahead and then I say, take this, take this, take this, I'll be making a medical mistake. So the best advice is you could actually visit a doctor near you who will be able to do all these tests to really confirm, why is your woman not getting pregnant? Is it the woman with the problem or it's the man with the problem? And then, of course, after proper assessment, medications can be recommended. But still, you can get my numbers on WhatsApp. We shall be able to dig deeper in this. I'll be able to teach you. I'll be able to teach you about fertility so that you can understand why she is not getting pregnant. Maybe you could think the issue is with the woman, and yet maybe it could be an issue with the man. Okay, so the numbers are on WhatsApp. Next question: can one get pregnant after an ectopic operation? Okay, then, can a woman get pregnant after an ectopic operation? First of all, we shall simplify these things for our friends who may not understand things like ectopic. Now, the word ectopic, if you see the word ectopic on your report, ectopic simply means something that is outside. Okay, I'm supposed to be here on this live session, maybe talking to you, but instead of being here, okay, I'm not a drinker, but maybe you find me in a bar. Okay, like right now I'm supposed to be on TikTok, okay, answering fertility questions, and then maybe I'm in a bar taking, like, okay, maybe doing all that. Okay, it means I've kind of like become more of an ectopic thing. I mean ectopic, like I'm in a place where I'm not supposed to be. An ectopic pregnancy simply means that the pregnancy is outside where it's supposed to be. If this is the woman's uterus, and then the pregnancy is supposed to grow inside the woman's uterus, and then all of a sudden the pregnancy is outside the woman's uterus, maybe it is in the fallopian tubes. Maybe the egg came out and then the pregnancy, instead of going through the fallopian tubes, it went backwards into the intestines. We call this an abdominal ectopic pregnancy. Normally, what was the question? Can a woman get pregnant after ectopic? Okay, so normally this is what we call an ectopic pregnancy. I was first of all defining an ectopic pregnancy so that all of us know what an ectopic pregnancy means. Okay, ectopic pregnancy means that a pregnancy is outside the uterus. The pregnancy is in the fallopian tubes. The pregnancy is maybe in the intestines. The pregnancy is maybe in the cervix. We call this a cervical ectopic pregnancy. How can you confirm an ectopic pregnancy? You do an ultrasound scan, you do a transvaginal ultrasound scan, or even a pelvic ultrasound scan. It will definitely show that the pregnancy is not inside the uterus. Why? The scan doctor will tell you that the inside of the womb is very clean. The endometrium is around 8 millimeters. Okay, for you will tell the doctor that, you know what, but I'm pregnant and the pregnancy is 3 months. 3 months pregnancy is normally a big pregnancy. But when you are counting 3 months or 2 months and the scan shows that inside the womb is empty, but inside the fallopian tubes there's something, we call this a ring of fire appearance. The doctors for scan know this. It's called the ring of fire appearance. Satura and maybe some fluid, and then maybe there's like a heartbeat, okay, a katuja in the fallopian tubes. Normally, your doctor will go ahead and then, of course, correlate or compare with what we call a urine HCG pregnancy test. And the urine HCG or the serum HCG pregnancy test is positive, and the uterus is empty, but there's a sac inside the fallopian tube. The uterus is empty, but there's a sac around the cervix. Then that could actually confirm what we call an ectopic pregnancy. Okay, then after confirming that there's an ectopic pregnancy, your doctor will advise you on the possible treatments. This could actually include operations on your fallopian tubes or on the fallopian tube to remove that ectopic pregnancy. If you identify this earlier on, your doctor would maybe opt for an operation known as a salpingostomy. If it is identified late and maybe the sac is about to rupture, your doctor could maybe opt for an operation known as a salpingectomy. This can be confirmed or this can be discussed by your doctor. The question was, will a woman get pregnant after this salpingectomy, after this salpingostomy, after removing the pregnancy? Will a woman get pregnant after the pregnancy has been removed from the fallopian tubes? The answer is yes, as long as the remaining fallopian tube is still open, as long as the remaining fallopian tube is still patent. Okay, what do you need to do? You need to go back to hospital, talk to your doctor, who could maybe request a repeat HSG X-ray to really confirm. Okay, the other fallopian tube was affected, but the remaining fallopian tube, is it good? Because you could be saying, you want to get pregnant very fast. You had an ectopic, you want to get pregnant very fast. But when the remaining fallopian tube is also affected, Because according to studies, it's a known fact that when a woman has had an ectopic pregnancy, the remaining fallopian tube is at a very much higher risk of also getting blocked. So it's always very advisable that you confirm with your doctor, who will maybe do a repeat HSG X-ray. If the repeat HSG X-ray confirms that even the remaining fallopian tube is also having issues, of course there are newer treatments like maybe the diagnostic laparoscopic surgery procedures which can be done on you. There are other home-based remedies you could look at, but the best is the diagnostic laparoscopic surgery can be done on you. And then of course after tubal unblocking, successful tubal unblocking, and of course with proper guidance, you can always actually try for pregnancy again. The answer is yes, you can get pregnant again after an ectopic pregnancy or after an ectopic surgery, as long as the remaining fallopian tube is open, as long as the remaining fallopian tube is not affected. But remember, if the results of the HSG come out and they do confirm that even the remaining fallopian tube is affected, okay, meaning that you have what we call total tubal blockage, total fallopian tubal blockage. If the scan shows that the X-ray, if it shows that HSG X-ray, if it shows that you have what we call total tubal bilateral, okay, total tubal blockage or bilateral tubal blockage, totally, the remaining options for you to get pregnant could actually be through what we call assisted reproductive technologies. These include methods like the in vitro fertilization, also known as IVF. I think that's enough about the fallopian tubes and then all that. You can always message me on WhatsApp. The numbers are on my bio. Remember, if you are watching this and you are in the UK, you are watching this live session and you are outside Uganda, you are in Kenya, South Africa, Egypt, okay, we have friends from Sudan, we have friends from South Africa, we have friends from the UK. If you are watching this live session, you can message me on WhatsApp. Maybe you have some burning question and you'd like to consult me. It's only $3 US, just around 11k Uganda shillings. You can message me on WhatsApp, then I'll be able to answer your questions. Normally it's only 5 minutes to 10 minutes and you have the answers, okay? Yes, I believe by the grace of God, I can at least contribute on your fertility journey, okay? Yes, you can be trying the fertility things alone. You are using Google, you are reading things on Google, you are reading about this, you are reading this, and the more you're reading, they are confusing you. As a woman, please, as a couple, you can always talk to an expert who will be able to draw a roadmap for you. Because if you're traveling from point A to point B, you need to get someone who has helped over 50 people get pregnant, okay? Over 50 people get pregnant, okay? These are documented success stories. So you need to get someone who has done it for like, by the grace of God, it's not me doing it, okay? Yeah, but guiding you that, you know what, when you follow A, B, C, D, you can reach to this step. So you can always come on WhatsApp and then we can actually, too much explanation. Yes, actually there are some of our friends, Susie, who prefer that deep explanation, okay? I could also decide to like talk superficially, just like, do this, but like I always like to go to the root cause. So I really hope you are okay with it. I tend to go deeper in issues. I don't just say take A, B, C, D. No, I tend to go like deep, okay? To really dig for you what is really happening, so that when you reach on the tablets part, okay, when you're taking Clomid, you'll know that I'm taking Clomid because of A, B, C, D. I'm taking maybe coenzyme Q10 because of A, B, C, D. I'm taking maybe myo-inositol because of A, B, C, D. I'm taking D-chiro-inositol because of A, B, C, D. I'm taking vitamin D3 because of, as in, it's really very good for you to know the deeper part of it. I don't know, but I believe there are people who prefer like to understand really what is affecting them, okay? So, Susie, I really hope that you bear with me, yes. Okay, explanations. Oh, we have I have a friend, Ramuyoyo. Yes, Ramuyoyo, I'm really very happy. And Kanyesije. Okay. Ramuyoyo, thanks for following. I've sent the invite. You can actually join me. Yes, I'm really very humbled that you have joined me, my friend Ramuyoyo. Yes, sending my greetings to all our friends at Kani Medical Center. Yes. Yeah, long time. So yes, long time, Ramuyoyo. It's been a while. Yes, it's been a while. But I'm really happy to see you here. Yes, I'm so humbled. Yes, human beings always meet. Okay, so I'm so humbled and I'm really so happy. Thanks for the support. Yes, remember, you can always message me on WhatsApp, okay? Yes, we can always, you can even let me know in case maybe you had something maybe to ask. Yes, I'm very, very ready to answer any of the questions. So the days, what are the days that one can get pregnant after periods? Okay then, so Susan, you're asking about the days a woman can get pregnant after periods. Okay then, the best days for a woman to get pregnant after periods, this depends on the length of the menstrual cycle, okay? Yes, if you have a 28-day menstrual cycle length, if your cycle is for 28 days, then basically we divide 28 by 2, we get 14. Then we count from 14, 13, 12, 11th, okay? Beginning from 11th up to your 14th day, those are the days of getting pregnant if you have a 28-day menstrual cycle length. But if your cycle is for 30 days, then we get divided by 2, we get what? We get 15. So we count from 15, 14, 13, 12. Okay, so you begin from the 12th part. Basically, you divide by 2, and then, of course, you actually go backwards the 4 days. But remember, if your cycle is a short one, maybe you see your periods twice in a month, then the calculations change, okay? Yes, you can actually message me on WhatsApp, and then we shall go deeper. Yes, we shall go deeper. We shall go deeper with this. Yes, Savage Daughter, send me a message on WhatsApp. Yes, but I'm actually located in Kasangati, Wampewo, Gayaza Road. But if at all you are far away, most of our friends, they tell you they are far away, they cannot travel to our clinic. Always remember, I'm available 24/7. It was actually during the time, but on WhatsApp, it is 24/7. So if you have questions you wanted to ask about fertility, and you're ready to actually book, okay? Pay the kafiri $US for the consultation, even at midnight, I'm available 24/7 on WhatsApp. But at the clinics, basically from 9 a.m. up to midday. But on WhatsApp, I'm available because this can actually apply to you if you are far away. Maybe you are in Kenya, maybe you are in South Africa, and you would like to ask a question. It's much more easier on WhatsApp. So find my WhatsApp numbers in my bio. Okay. I think that's enough. It's 5:32 p.m. Let me try to be fast. How do I deal with stagnant follicles? Next question is about stagnant follicles. How can a woman deal with... She used the word stagnant follicles, but I think the best word is follicles that are not growing. Okay? Now, we don't know... And what meters of follicles is enough? What meters of follicles is enough? Of course, I'm requesting that you will need to actually maybe message me the ultrasound scan reports, and of course the reports you use to really confirm that the follicles are stagnant or they are not growing, and then maybe the related hormonal test reports. But in a nutshell, you say that the follicles are not growing, the follicles are stagnant. How can you deal with them? Now, a woman could have issues with her eggs not growing. Eggs are follicles, okay? Or we could actually call them oocytes. A woman could have issues with her eggs not growing when the real cause is in the brain. A woman could have issues with her eggs not growing when the real issue is in the hormones. A woman could have issues with the eggs not growing when the issue was there at birth. We call this primary ovarian insufficiency. We call this primary ovarian failure. If a girl was born in this world with this condition, primary ovarian failure, primary ovarian insufficiency, and then she's asking, I'm not saying that you have this condition, but I'm basically generalizing. If a woman has this condition, primary ovarian insufficiency, and then she's asking herself why the eggs are not growing, the problem started at birth, okay? That's why you have the night sweats. That's why you really feel like every time the whole body, you feel like hot flashes. Why? Because there's an issue that started from birth, okay? If a woman has a condition like maybe polycystic ovarian syndrome, whereby the follicles are very small, okay? Very small, there are very many, they are appearing as if they are kind of like beads, okay? Bead-like appearance of your follicles, your eggs on ultrasound scan. Then to manage or to enable these eggs to at least to grow, because normally it's a long-term story, but for you to at least maybe bring about at least one follicle growing. Remember, when you have PCOS, you can get pregnant, okay? So for you to have an egg coming out that is actually going to grow, that could actually be dominant, that could actually be fertilized, you need to correct the PCOS. Because the question was, how can you manage dominant follicles? And I was like, we go backwards to the root cause. Is it primary ovarian insufficiency? Is it primary ovarian failure causing the stagnant follicles? Is it PCOS causing the stagnant follicles? Is it an issue with your hypothalamus, pituitary, and ovarian axis? Is it an issue coming from the brain, affecting your hypothalamus, affecting your pituitary, or even an issue affecting your ovaries? Is it an age-related issue? Are you already like maybe premenopause, about to go into menopause? It's a long story. That's why I'm like, if you could come on WhatsApp, we could actually dig deeper on this, okay? Go backwards, identify what caused the stagnant follicles, correct that. It could be metabolic, it could be hormonal, okay? It could be ovarian. Someone said I need to be fast, so let me try to be fast. Yes. Okay. Ashaba, hi. How are you doing today? Hope everyone is okay. Yeah, sending my greetings to you, Ashaba. Thanks for joining today's live session. Chasimire Joan, thanks a lot for joining today's live session. Chasimire is asking, what can I use for itching face with rash part from steroid creams? She used steroid creams. Remember, we have two types of steroids. We have the glucocorticoid steroids, and then we have the mineralocorticoid steroids. So she's saying that she has itching face with rash apart from steroid cream. Oh, okay, then itchy face with a rash apart from steroid creams. Yeah, actually, it's very good that you've specified about the steroid creams, because the commonest, the most available medications or therapies for issues with rash and then itching, itchy face and then all that, or even pimples in the face when you go maybe to a nearby health facility. In most cases, your provider could actually begin with the steroid creams, okay? This could include the betamethasone, they could include the eskedam, they could include many of the steroid creams. But remember, we need to go back to the root cause, okay? Yes, I'm going to insist on the root cause of issues, because it's where healing begins from. If you identify the root cause, okay, you may be thinking that you have malaria because you're shivering, okay? You're shivering, you might be thinking that it's malaria, and then you begin pumping yourself with Lonat, maybe with antimalarials, okay, Deocortexin, okay, Firi, but you're not getting better. Why? You didn't identify the root cause. You didn't go for the blood sample, okay, to really confirm through microscopy. Do you have the malaria parasites, the Plasmodium? Okay, which type of Plasmodium are you having? Okay, is it P. vivax? Is it Ovale? Okay, is it like once you identify the root cause and the severity, how things started, management becomes much more easier. So she has an itchy face, but apart from steroids, what can be done? Okay, so when the face is itching, normally we need to first of all identify, like, why is the face, like, why are you having your face itching? Is it a result of maybe something you applied that actually brought about the itching? Because the itching could be a reaction. Your skin, your face is telling you that, you know what, whatever you used, okay, that Chizigo, that lotion you applied, it was not good. What can you do in such cases? Stop the lotion. Stop whatever you used that brought about the itching. Sometimes the things we think that they are simple, sometimes they are the things that actually work. So if the itching was brought about by something, like maybe you applied on your face, please, you need to stop that. If it is a particular soap, as a woman, maybe you saw this soap, it's being talked about here on TikTok, and then you're like, let me buy it. Then you apply like this, the itching begins. You need to stop that particular soap. You stop it, you can actually go back to normal. You stop and then you go back to the ordinary blue soap for washing clothes. I hope if you are in Uganda, you know the blue soap. But there's a reason why that blue soap for 500 shillings is being recommended in the skin clinic in big hospitals, okay? When you go to skin clinics, normally they'll tell you that, you know what, go back to blue soap, Star soap, okay? Very cheap, but very, very effective, because when they are making this soap, this cheap soap, the blue soap, okay, they don't use those complicated chemicals, okay? Yes, they actually go ahead, mix the cooking oil, or mix cooking oil with maybe sodium hydroxide, and then add some colors, and then they make that soap. So basically cooking oil is good. So you could actually look at stopping whatever you used that brought about that itching. I hope I'm right about this, okay? Before you even talk of the steroid creams, the betadine, and then the rest of the things, stop the irritant Stop that stuff that caused the itching. Next, if the itching is due to allergy, okay, reactions coming in, you need to identify exactly what are you reacting to. Okay, still it goes back to, yes, it goes back to what caused the itching. So you need to identify if the itching started maybe when you were involved in, maybe you were in a very sunny place. You could look at maybe getting, maybe like there's this round cape you can put on to try to reduce the exposure of sun to your face, okay? So the other thing is that the itching of the face could actually also be due to maybe hormonal changes. I mean, you could actually talk to your doctor, the specialist for skin. Yes, it's called the dermatologist. Yes, dermatologist, doctor for skin. You could identify a skin doctor near you, dermatologist. Now they will go deeper. Okay, they can go deeper and then they can identify really what type of like itchy face are you having, and then of course they can actually advise more. But for me, like the little I know about this, please, you need to identify the root cause. What caused the itching, and then stop it. Once you stop it, I believe you can get better. But please confirm with your skin doctor, confirm with your dermatologist. Wow, the questions are over. Low back pain on the right side. What causes low back pain on the right side? Now, we know very well that pain is basically when a person is not feeling well. In this particular case, she's a queen. She's asking about this, so I suppose she's a lady. So she's experiencing low back pain on the right side. Now, when a woman has low back pain on the right side, low back pain on the right side, not low abdominal pain, low back pain. Okay, so when a woman has what we call low back pain, and this pain is on the right side, normally we need to look at what could be on the right side. Okay, we know that maybe it could be occupational, maybe due to oversitting and then all that, but there could be something that could actually be much more sinister, that could be much more serious, that could be causing this. Okay, and that's why we need to go and then begin with our abdominal pelvic ultrasound scan. Of course, it will give a clear picture of your cervix. We call this the fallopian tubes. Are they okay? Okay. Remember, the best scan for the fallopian tubes is the HSG, but you can begin with an abdominal ultrasound scan. Why? Because it could actually give pictures on your right side, what is happening. Your doctor will scan even the back area, but in most cases, your scan doctor will begin with the front part. Okay? Your doctor could actually pay close attention to your right side. He could actually look at your ovarian tissue, that part where the eggs are stored. You could be having pain on the right side, but when the issue is due to a growth or a swelling, we call this a cyst on your right side. The ultrasound scan can easily confirm this. You're getting pain in the backside, on your backside, but the pain is because of that cyst which is on the front part. Please keep tapping on the screen. Keep tapping on the screen so that I can know that you are still on the live session. I'm about to summarize, around 10 minutes to go. So you begin with an ultrasound scan. The scan will show whether the pain is due to that swelling. The scan will actually show whether the issue is with fluid which is accumulating in the tubes. Amazi Monseke. Okay? You could be getting back pain on your right side when the right fallopian tube is filled up with fluid. You could be getting pain on your right side. That pain is at the back area when the issue is with a small part known as the appendicular part. We call this the appendix. It could be an issue with your appendix. You're getting pain in the backside, but the appendix is swollen. We call this inflammation. It is inflamed. It is swollen. How can you confirm this? We go back to the ultrasound scan. Normal appendix is supposed to be at least up to around 10 centimeters. I believe 10 centimeters or 10 millimeters, I'll confirm. But if the ultrasound scan shows that your appendix is enlarged, your appendix is swollen, your appendix is filled up with fluid, then it could actually be the reason as to why you are experiencing pain, which is going to the backside. So you don't take Panadol. You don't take the pain something. No. Okay, as a first aid, it's okay, but it's always advisable that before you actually begin on painkillers, first go to hospital. Your doctor will do a proper assessment on you. If it is an appendix issue, appendicitis, your doctor can easily point towards this during a proper abdominal examination. We call this deep palpation. This will be done by your doctor, who will be able to actually try to point towards the appendicular region, but confirmation will be done via an abdominal ultrasound scan. We call this an abdominal pelvic, because you could think it is an abdominal issue when it is a pelvic issue. So you do what we call an abdominal pelvic ultrasound scan. Someone said I should be fast. I should be fast. So let me try to be fast. Joe, thanks for reposting. Thanks a lot for sharing. Thanks a lot, Joe. Thanks a lot for the support. And please, friends, share. This information is very, 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 it could actually help a friend out there. So please share this live session. Okay, if you've missed your question being answered today, by the grace of God, please, tomorrow, tune in. 3 p.m. up to around 6 p.m. Ugandan time. Okay, you can always tune in and then I'll be able to answer your questions. Do not get hurt. Do not get annoyed. Worry is not good. Worry is not good. If you get stressed over small things, then your body will release a hormone known as cortisol, stress hormone. Then it will again continue affecting you. Yes, so I've talked about clots in the period. I said that clots normally are due to changes that are happening inside your womb, okay, inside the endometrium. Normally these clots could be due to hormonal changes. Maybe estrogen is much more higher, maybe progesterone is low. Maybe progesterone is much lower, estrogen is higher. So hormonal changes could actually bring about this. But normally within 2 to 3 months, 2 to 3 cycles of you receiving your periods can actually go back to normal. Sometimes it could be something simple, whereby you don't need to put yourself on stress, okay? You can observe for 2 to 3 months. If things worsen, you can go to a hospital near you, and then your doctor will be able to guide you on this, okay? Next question. Coming in from Abbas. Hello, Abbas. Thanks a lot for staying on the live session. I hope you're still on. I feel slight pain, but immediately I see periods, it stops. What's the problem? Still, this light pain you feel before seeing your periods could actually be among the signs known as premenstrual symptoms, okay? The pain you are experiencing, you feel slight pain today, tomorrow you see your periods, it is among what we call, it's among a collection of signs known as the premenstrual syndrome or premenstrual signs. These include that pain you feel, they include that low abdominal pain, they include maybe hormonal changes. You can even feel as if your breasts are kind of a bit big. If a lady is trying to get pregnant, if she's a TTC mother, she could actually begin, it's always advised, but don't begin celebrating before you see the HCG test, okay? Yeah, but if you've been trying to get pregnant, you might feel your breasts enlarging. You might feel, some women feel the urge to have sex, okay? They really feel like they really want to have sex very much. It actually goes back to the hormonal changes. We call these premenstrual syndrome, premenstrual signs, okay? It's a normal thing. It's a normal appearance. It's a normal phenomenon. You don't need to stress yourself, okay? But if it persists, you can always actually go ahead and then confirm with your doctor. I got an ectopic last year, so I went for HSG, but still no. Johnson, kindly share. Find my numbers on my profile, both on YouTube and on TikTok. Please come on TikTok, come on YouTube, and then let's dig deeper on this. I like addressing the root cause of issues. Identify why you are not getting pregnant. Having had an ectopic, okay, last year, and you are not getting pregnant. You did an HSG, but still you're not getting pregnant. Please come on WhatsApp and let's dig deeper in this, okay? What can increase follicles? Wow, our friend, okay, Dennis, okay, I will not mention your name. You are interested in how to increase the follicles, okay? But we need to, first of all, look at exactly, like, what is really happening with your follicles, okay? We need to really identify what is happening with the follicles. What made the follicles to maybe be stagnant? What made the follicles not to grow very well? We identify that, we can actually look at maybe the best remedies to actually bring about these follicles to grow. Why? Because we know very well that a follicle, an oocyte, an egg of a woman, it actually has different layers. It has a covering on top, which is actually known as the theca cell. It has also another layer of tissue known as the granulosa cell. Granulosa cell is what actually produces the AMH hormone. If you've ever checked for AMH, AMH comes from the granulosa cells of your egg. It is also that fluid part known as the follicular part. So we need to really identify exactly what is happening with your eggs, and then we shall talk about the best remedies. So please come on WhatsApp, and then we shall dig deeper in this. I'm trying to be very fast. Abbas, you've said thanks a lot. Yes, thanks for appreciating. I'm also very humbled. Yes, let me be very fast, very fast. It's been 2 months, and I've been spotting, and I'm not pregnant. 2 months, she's spotting, but she's not pregnant. 2 months, she's spotting, but she's not pregnant. Normally, what could be causing this could actually be due to changes that are happening in the body. Now, we need to identify why you are spotting for 2 months, and yet you are not getting pregnant, and yet you are not pregnant. Because we know very well that in most cases, when a woman sports, it could be a sign that she's pregnant. But if it has gone beyond 1 month, you are now at 8 weeks, those are 2 months, you are sporting, but you're not getting pregnant. Hormones. But we need to identify where the big question mark is. Is it on estrogen? Is it on progesterone? Is it on FSH? Is it on LH? Is it coming from the pituitary gland? Or it is actually an issue with the thyroid gland, okay? So still, Tash, Korea, please come on WhatsApp. You said that you even took Clomid, but still nothing. Come on WhatsApp and then let's dig deeper on this. Trying to conceive, but instead get my periods. Yeah, exactly, come on WhatsApp. Can any hospital do all the tests? Yes, most of the fertility specialist hospitals do all these tests, okay? Yes, fertility specialist hospitals do these fertility tests. There are very many hospitals. When you go to Rwanda, there are lots of hospitals in Rwanda doing these fertility tests. When you go to Kenya, there are hospitals. When you come to Uganda, there are fertility hospitals. So, yes, this actually gives me an opportunity to actually to mention it. If it's a fertility hospital, you are maybe working with a fertility hospital, maybe you are the director of a fertility hospital, and you are looking at maybe getting qualified leads, getting qualified clients. You can always reach me. You can message me for business. My numbers are on my profile. You can always reach me out, and then yes, these clients need places to do these tests. So it could actually be a serious part of working. We can work together and we can grow together. So if you're a fertility hospital, the clients are here. You can always actually reach me for business. Okay, I could represent your fertility hospital, send you clients. Okay, yes. So nasubuga peti bananzizamu mu lubuto molar pregnancy kati 2 weeks naye nakoze test elaga ndi lubuto after a molar pregnancy. Sorry about this, nasubuga, sorry about this. Yes, naye nagambye nti molar pregnancy kiba kitegeeza olubuto luba terwasobola kukula. Kyava kuki? Kyava ku nkyukakyuka ezaali mu nabaana muli munda. Omwana yali atandise okubanga akula n'ataforminga bulungi n'afuuka kye tuyise a molar pregnancy, tukiyita a gestational trophoblastic disease. Kibeera ne hormone oba kifulumya hormone gye bayise HCG nga nyingi nnyo. That's why bakigyemu naye era kikyafulumya hormone gye bayita HCG. Solutions. Olina okumakinga sure nti owummulamuko oba olindamuko ne bayitawo emyezi 2 ku 3 hormone eno gye bayise HCG egyakendeera. And then of course osobola okuba nga ate ogezaako ate naye jjukira osobola n'okujja ku WhatsApp ne tuwayamuko. Yes, most of our friends when they come on WhatsApp, you tell them book a consultation, they don't want. Okay, yes, but it's actually very important. You need to realize that the world has actually moved, and you can actually get support. Okay, even if you're in South Sudan, you can actually get support. You can get answers on WhatsApp. Okay, you need to begin believing that you can actually get genuine advice. Okay, from certified fertility coaches. So come on WhatsApp. Let's dig deeper in your questions. So jangu ku WhatsApp nansobuga tujja kuba twongera okubayamuko. If I play during periods, can I get pregnant? Next question is coming in from a friend. If she has intercourse with her partner, if she plays sex during her periods, can she get pregnant? During periods, it's advisable, please, unless if it's unavoidable, but during periods, it's advisable that you wait, okay? You be patient. Finish your periods at least 3 to 4 days, and then you can have intercourse with your partner. If it is something you cannot control, sex is emotional. Sex is an emotional topic, okay? If the feelings are so much and you cannot control, nothing to do. But for pregnancy to happen, you actually have to finish your periods. After finishing your periods, give yourself time for these eggs to grow. Because periods means that the eggs didn't grow. They were shed out in form of they just came out, and okay, pregnancy didn't happen. So if you are shedding whatever is you're shedding in the periods, and then you are having intercourse, pregnancy, normally the chances will be much more lower. If a pregnancy, if a woman gets pregnant after being with her partner, and yet she was actually maybe seeing blood coming out or maybe spotting, it simply means that she was already pregnant. Okay, what she saw was as if periods, that was actually spotting. It was implantation bleeding. For her, she called it periods. Those are the women. I did a video on TikTok and I was saying that it's difficult for women to get pregnant during periods, and that video, people were arguing, okay? Yeah, they were saying that, you know what, they had sex and then during periods they got pregnant. No, what you were calling periods, basically that was what we call implantation bleeding. So you had intercourse when you were experiencing spotting, but it's advisable for the safety of your tubes, please finish your periods, and then after you can try for pregnancy after at least maybe 10 days or even 7 days or even 11 days, depending on the length of your cycle. It's not advisable to have sex during your periods. Why? Why are you telling us this, Gerald? Why are you telling us that don't have sex during periods? When you are having intercourse, when you are having sex during your periods, the blood which is supposed to come out, okay, simple, the blood which is supposed to come out is going to go backwards. It's going to go to the fallopian tubes, and when it reaches the fallopian tubes, it will sit in the fallopian tubes. It will wait for you when you try for pregnancy. And then, of course, when you try 1 year, 2 years, 3 years, you go for HSG in the hospital. They do the HSG accident. They tell you, both the tubes are filled up with dirty things. Why? Those dirty things went into the tubes when you were in your periods and you had sex. Okay, next question. Is it easier to conceive if you got 2 ectopic pregnancies and then they were removed? 2 ectopic pregnancies. If these ectopic pregnancies, these pregnancies outside the womb, if they were on either parts of your fallopian tubes, both the right and the left tubes have been removed, you are asking, will you be able to get pregnant? Yes, you can get pregnant through newer techniques, through newer procedures like the assisted reproductive technologies, including IVF, in vitro fertilization. So if you are a lady and both your tubes have been blocked or have been removed, you can always try out IVF. Visit a specialist fertility hospital near you, and then they will guide you on IVF. Yes. Abbas, I believe I've answered. I'm pregnant, but I have an infection. A woman who is pregnant and she has an infection, she needs to visit the hospital where she's getting her antenatal from, and then they will guide her. They will guide her on the proper tests to be done. Why? Because during pregnancy, there are some drugs that are actually that are supposed to be given, and then there are some drugs that are not supposed to be given. Okay, so if you are pregnant and you have an infection, you are having difficulties passing urine, you are having like discharges coming out, please, you need to confirm, or you need to go to a hospital near you where proper tests will be done to confirm exactly what type of infection do you have, and then your doctor will advise you on the best medications you are supposed to use. Because if you do self-medication, you could take medications which could affect the health of the baby. I think I've simplified it. You can also message me on WhatsApp. Yeah, so I have some clothes in the periods. I've answered this question. Please, I've answered like 3 times. Back pain, I've answered that question. Okay, next question is about a friend. She's saying, I want to try letrozole or clomid, which one is better? Please, we go back to self-medication. Self-medication is not good. You're talking about taking letrozole or clomid. You are asking yourself which one is better. The best advice is you need to go to your doctor who will guide you on which specific medications you are supposed to take. Why? Gerald, why are you telling us that go to the hospital, go to the doctor? Because you could actually end up spoiling everything. I believe you're trying to get pregnant, okay? You're trying to get pregnant. You're on pressure. You really want to get pregnant. So and so has got pregnant. At home, the in-laws are asking you, why are you not getting pregnant? But just because you are trying so hard, you could realize that in that desperation, in that rush you are in, you could actually spoil things. Why? Letrozole is a fantastic drug. Clomiphene or clomid is also fantastic, but these drugs support women who are having issues with maybe ovulation, ovulatory issues, women who are having issues with their FSH and LH hormone. Okay, so if you go ahead and you self-medicate, you could actually spoil things, because you are at risk of getting complications like ovarian hyperstimulation syndrome plus other side effects. Do not self-medicate. Visit your doctor who will guide you through proper tests, and then your doctor will recommend. You may think you are supposed to take clomiphene, and yet there's something much more superior to clomiphene. You may think you're supposed to take letrozole, and yet there's something much more stronger than, maybe it's much more better for you than letrozole. Okay? Clomiphene belongs to a type of medication known as the selective estrogen receptor modulator. What does it do? Gerald, you're telling us all this. What does clomiphene do? When one takes clomiphene, okay, Each tablet is 50 milligrams. If you take clomiphene right now, what it does, it's going to go in your system, okay? Once it reaches your system, it's going to tell estrogen hormone, estradiol, is going to lower your estrogen. Now, this is going to happen by force. But remember, you didn't have issues with estrogen, you didn't have issues with FSH, you didn't have issues with maybe LH. But once you take clomiphene, that is self-medication, I'm telling you how it's not good. When you take clomiphene, it's going to lower your estrogen. Once it lowers your estrogen, okay, the brain is going to sense that, you know what, estrogen has been lowered. Yeah? For us, we were waiting for estrogen to lower maybe during this time or during this time. But this particular person, okay, our friend has taken estrogen. Now, you know what? Estrogen is low. Now, FSH and LH, you go. Then FSH will put on its boots, okay? I'm trying to explain. FSH will put on its shoes. You know what? Let me rush. FSH will travel very fast to your eggs, okay? And then it will try to make your eggs to grow. It will try to force your eggs to grow. But remember, before taking the clomiphene, your eggs were already normal, okay? Maybe the failure for you to get pregnant was tubal. Maybe the tubes are blocked. Your eggs are very normal. They are of good quality. Your FSH is normal. Your LH is normal. The eggs are very okay, but the tubes are blocked. The egg quality is very good, but the tubes are blocked. And for you, you've just done self-medication. So FSH will try to make the eggs to grow very fast by force. And then, of course, when you make the eggs to grow by force, the eggs will become stubborn. They will continue getting filled up with fluid. Remember, there's some fluid, follicular fluid, that fluid inside the egg. But if you force it with clomiphene, the eggs will get filled up with more fluid, and then this more fluid will make the eggs to grow, go beyond 3 centimeters, go beyond 4 centimeters, go beyond 5 centimeters, go beyond 6 centimeters. When you do ultrasound scan, the doctor will tell you, on the right side, there's a big tubal ovarian cystic mass measuring 7 centimeters by 7 centimeters. And then maybe it's like kind of like there are maybe 2 or 3 of them, and then of course you could actually end up in surgery because of clomid. So please kindly do not self-medicate. Go to your doctor. I repeat, go to your doctor. Your doctor will guide you on the best treatment protocol. Please do not self-medicate. Why? Because when you finish this live session like this and then you go through TikTok, I'm not saying that I'm not saying that I'm campaigning for myself, but I'm educating. When you go through most of the videos, they'll tell you take this, take this, take this, take this, take this, take this. But you might go take this and then it could actually land someone in theater operation. So please kindly go to your doctor. Your doctor will guide you because he's a specialist. Your doctor will guide you that, you know what, according to this and this and this, you need to follow this step. And by the grace of God, you can actually get pregnant. Please do not self-medicate. Tomira bumizi ddagala gende wa doctor wo akuguiding. Why am I not getting pregnant? Since last year, October, that's when I had a miscarriage. Normally, it could actually be among issues with your fallopian tubes. It could be an issue with your eggs. It could be an issue with the uterus, or it could be a male factor issue. Okay? Kiyinza okubeera ku side ey'omusajja, ey'omukazi, oba kiyinza okubeera ku side ya hormones oba amagi. Next question. I see periods every month, but 10 years. Me, I see periods every month, but 10 years. Please, Fiona, try to actually go, like, to rephrase, okay? Try to rephrase the question. You've said that you see your periods every month, but 10 years. The question is not complete. Please complete the question. Remember, I'm called Gerald Massa, and I'm a certified fertility coach, certified by the American Society for Reproductive Medicine. You can always ask your questions. We can have a chat. We can have a chat, and I could actually guide you on the next steps to take on your journey. Okay, if you are already under treatment by your doctor, I'm not replacing your doctor, no, but I can help tell you that, you know what, take your medication, but add this. Take your medication, but add this, okay? I think the questions are done. Okay, the questions are done. YouTube, Kwagala, patience. Okay, thanks a lot for today's live session. It is already 6 p.m. Those who missed, please, you can join tomorrow, 3 p.m. up to 6 p.m. I'll be on YouTube, okay, YouTube and TikTok, beginning from 3 p.m. up to 6 p.m. It's now 6 p.m. Ugandan time. If you are outside Uganda and you have missed this live session, please, tomorrow come again, okay? By the grace of God, we shall be here talking about fertility. simplifying fertility. My goal is to reach 1 million couples with fertility education, whether you are inside Uganda or you are outside Uganda and you are suffering with fertility. You are trying for pregnancy, but things are not working out. You need someone to guide you. You need someone to coach you. I'm a fertility coach. I'm certified by the American Society for Reproductive Medicine, and I'm also licensed. I can actually guide you. I can advise you. I don't replace your doctor, but I can coach you. Okay, go on Google and read about fertility coaches. Okay, most people actually, when they come on WhatsApp, they ask me, what does a fertility coach do? What is a fertility coach? Okay, yes, so a fertility coach is already a licensed medical professional, but they add on, okay, they add on something to become fertility coaches. So please, I can guide you. I can actually advise you that, you know what, add on this, add on this, add on this. By the grace of God, pregnancy can happen. I've seen it happen for 50 couples. I will not mention their names here, but 50 couples. That means that fertility coaching works a lot. Yes, and if you are a hospital, you have a hospital and you need a coach, a fertility coach, someone to coach your patients, someone to advise your patients about fertility, someone to teach your patients, please send me a message. Yeah, let's do business, okay? We can work together on the journey to parenthood. Okay, it's 6 p.m. I'm called Gerald Massa. Let me see you in tomorrow's live session by the grace of God from 3 p.m. up to 6 p.m. Okay, phone number, Bestie. Yeah, so Bestie, TikTok, they don't allow us to put phone numbers here, but you can actually check my bio. There's this yellow thing here, okay, that yellow stuff there, okay, Gerald Massa Fertility Coach. You can click in that stuff, that picture up here. My numbers are there. You can also check my profile. I believe you know how to check the profile. You can check my profile. There are 4 numbers. They are specifically for WhatsApp, okay? Yeah, I always tell my friends, like, put the questions on WhatsApp. Why? Because when you call, you could actually get disappointed. You could call when I'm traveling. You could call when I'm sleeping. You could call maybe when I'm like working on clients at the clinic. You could call when I'm also maybe not near the phone. So please, for us to work together very well, please put the questions on WhatsApp. Why? Because when you put the questions on WhatsApp, WhatsApp stores the questions. Okay, you don't need to say that now I called him, he didn't pick his phone. He's not serious. No, please, you put the questions on WhatsApp. At least WhatsApp can store the questions. When I'm so busy right now, as soon as I get some time, I'll reply to your questions. At least I try. Okay, I used to overdelay because of the busy schedule, but now every 10 minutes I check for questions on WhatsApp. So please ask your questions on WhatsApp. By the grace of God, you can get pregnant. That's one thing I can tell you, I can assure you. By the grace of God, you can get pregnant. What normally happens with couples trying to get pregnant is this. They normally do not understand why they are not getting pregnant. They've done all the fertility tests. They've done everything. They've taken the Clomid. They've taken the Letrozole. They've taken everything, but they're not getting pregnant. Why? Why are they not getting pregnant? And that's when a fertility coach comes in. I will talk about fertility coaches because in our country, fertility coaching, it's a new thing, okay? It's a new field. But you can go on Google and then read about fertility coaches, okay? What do fertility coaches do? Okay, do some research. Because you may be saying, Gerald Massa is telling us he's a fertility coach. But what do fertility coaches do? Go on Google. After this live session, read about fertility coaches. Okay? The role of fertility coaches in the UK, in the US, in Japan. What do they do? A fertility coach can complement on what your doctor is already doing. Okay? You may take metformin, you take letrozole, you take clomiphene, but things are not working out. You do tubal flashing, things are not working out. You talk to a fertility coach, 1 session, 2 sessions, 3 sessions. Next time, pregnancy test is positive. So it's actually a new field, but read about fertility coaches on Google. Okay? Yes, read about fertility coaches. I'm a fertility coach and I can guide you. Okay, that's enough. Savage, please. We are in Kasangati, Wampeo, Gayaza Road. Yes, but if you are far away, please, you don't need to stress yourself with transport. Only $3 USD. You can actually reach me on WhatsApp. Okay? I prefer WhatsApp because it can reach everywhere. Okay? Yes, I think that's enough about today's live session. Today we talked about back pain, but the test is negative. We talked about miscarriage after 7 weeks, what are the causes and how it can be managed. We talked about can a woman see pregnancy in 3 days. We talked about a metallic test in early pregnancy. I said it is a hormonal issue. We talked about dry skin around the neck. I said it is due to allergens. It could be due to reactions. We talked about periods when a woman is infertile. I said yes, a woman can see her periods and yet she's actually she's actually having difficulties getting pregnant, or she could see her periods when the issue is with the husband. And then we talked about azoospermia, I talked about oligozoospermia, I talked about asphenozoospermia, I talked about the Sertoli cells and the Leydig cells and how they go about to actually bring about what we call normal sperms. With all that said, I'm closing at this point, and yes, I think that's enough. That's enough. Thanks a lot, everyone who joined. I'm really humbled, and by the grace of God, let's meet tomorrow. Bye-bye, and have yourself a fantastic evening. Have yourself a fantastic night, okay? Yes, bye-bye. See you tomorrow, same time.